take your seats. The program will begin momentarily. On behalf of the Heartland Alliance, thank you for joining us today for the launch of the READI National Center for Safe Communities. Please welcome the Executive Director of the READI National Center, Dr. Chico Tillman.
When I look around the room, I'm truly humbled by how many people came out for the clarion call to answer the voices of the mothers and the community members that have been crying out for help for decades. So first of all, please give everyone around you an applause for coming out. My name is Dr. Chico Tillman, and I'm an Executive Director of the READI National Center for Safe Communities. I'm honored to welcome you to DC to tell you about the center and to have a conversation about how we can collaboratively work together to make our communities safer. This amazing group in the room includes speakers and panelists you will hear from today is a testament of how far the field has come in community violence intervention. Some of you have been doing this work for decades. Many of you have been in the streets working, de-escalating violence and conflicts. You've been in city halls and state houses, advocating, changing policies, making reforms. And you've been in boardrooms, caucus conferences, and even cabinet meetings, fighting to make CVI a pillar of public safety in America. And the work is paying off. This July, Congress passed the largest ever investment in CVI, $250 million. And they made millions more available for community-based programs in schools across America. That is historic and is a testament of all the hard work that you have done. I have to give a special acknowledgement and shout out to a person who has been a champion of this work, none other than Ambassador Susan Rice, for working with us tirelessly to elevate our voices, to give us a seat at the table, and to help us create change. But honestly, those resources are not enough, because money don't save lives. It has to be put to use because people save lives. And right now, the work that we do is extremely important because this is a moment that we have to seize right now. In communities across America, including my beloved Chicago, gun violence is still debilitating communities. It's still pretty bad. Some of it is because of the spike in COVID and the pandemic we went through. Some of it is because of the continuous historic disinvestment. Some of it is because of the lack of access individuals had during that period. But we can't use those as excuses to do nothing. We can't be hopeless. We can't rest in despair. We have to move to action. For young black men, gun violence is now what? The leading cause of death. More than 9 times our counterpart. That's a generation of young people that's traumatized, scared, and many of them are dying. That trauma not only results in the gun violence epidemic, but also it fuels the cycle of trauma. But I'm encouraged because the leaders in this room have proven we can break the cycle of violence because many of us have seen decreases in violence when we've had the opportunity to be funded properly and had the opportunity to work in our communities and do the work that we know they need. How do we create, though, or capture this work we've been doing? And that's an important thing, because many of us have worked based upon our struggle and our trauma and have created programs based upon our pain. Many of us have done the work but don't have the resources or the time to capture the data. But when we don't capture the data, sadly, we can't prove what we've done or if it's truly working. So we gotta find a way to capture what we're doing so that the numbers and the narrative can tell our story. Cities, just think about what happened with the ARPA funding. Cities receive funding, and many of you are in cities that either have an organization already doing the work, or you yourself have been doing work. But what about those smaller or mid-sized cities that's at the embryonic phase of trying to figure out how to mitigate this onslaught of violence that's been happening in their community? Those people need what? People like us to come in and do problem analysis, assessments, training, and TA, so that they can start where we're at now, as opposed to starting from where we started from and going through the many changes and iterations that we went through. That is why we're here today. And that's the reason why we at READI have took this courageous leap of faith and launched the READI National Center for Safer Communities. Earlier this summer, through the READI National Center, Heartland Alliance and our partners, I want you to hear that clearly, Heartland Alliance and our many partners, will work with cities, programs across the country to strengthen the CVI field through field support, systems change, knowledge sharing, and program innovation. In field support, our team of experts will provide partners with program design, consultation, leadership development, and training on using data to inform practices. To support system change and knowledge sharing, we will join our partners in developing CVI policy and advocating for an increase in CVI funding. And of course, we will continue to drive innovation through the READI program in Chicago by testing the curriculum of CBI, developing new pathways and programming for reentry, and forming new partnerships as we did in North Lawndale with several organizations working collaboratively and collectively together, not just sharing knowledge, but learning from one another of how we can better serve our communities. The READI National Center has already established a formal partnership with a few cities in Pennsylvania where we're supporting them. We're working closely and in conversation with Lake County and a few other cities just to share our support so that we can stop these cataclysmic events from happening in our communities. That's what the READI National Center aims to provide. But we can't, we won't, we're not going to be successful by trying to put READI in the forefront and do it alone. The only way we can solve the problem of violence in the United States is together. I need you to hear that, together. We all have to use our expertise, our talents, and our time and work collectively and leverage all the assets within the ecosystem to mitigate violence in the same way we combated COVID. So we need your help. As city leaders, researchers, funders, practitioners, and policymakers, all of us have to play a role. But most importantly, also direct service providers, boots on the ground, people in the trenches. We need everybody to work together. And lastly, business owners. We need businesses to open up opportunities for people who have been victimized and criminalized for decades so that they have a pathway into mainstream society. This field has so much potential to save lives, to uplift communities, and to end the plague of gun violence. But let me be real. This will not happen unless we're able to put aside our philosophical views, whatever ideology in this work we have toward whatever model, and we work together. We got to make a commitment and a stand that we're going to work together to save lives. And that work starts today. I know many of us have been doing the work for years, and the movement has already started. But at this moment, it's the next phase of the movement, and we have to capture this moment now because we might not have this opportunity with the resources, with it being on the lips of everybody, from people in the community all the way to people in the White House like this ever again. We have to seize the moment. And in doing so, we must what? Promote equity. We must promote opportunity. And we must give individuals in our communities an opportunity to what? Be integrated into this system in which they've been isolated for so long. That hard-to-reach program, that hard-to-reach population. What's interesting, and I'm going to introduce my sister in a minute. What's interesting, statistically, they say less than 1% of the population is at the highest risk and are the drivers of violence. But we in this room are the only ones with access to that 1%. Now, it's 99% on this side, and it's 1% driving violence. Instead of despair, that should give you hope. Because if you think about any scale, anything, just almost any equation, if I say, well, it's 99 on this side and it's 1 on this side, the first thing rationally you would think, well, the 99, I favor that side because of the capacity over here in comparison to that. And I'm confident as we've overcome many other things, many other struggles, we can do the same thing with that 1%. As a matter of fact, they say it's less than 1%. Less than 1%. Just think about it. Less than 1%. With this new phase, I need you to do some self-reflection and ask yourself, am I giving the best of me? Am I sharing? What's my North Star? What I'm hoping to get out of it? And lastly, what I'm willing to pay. I think the thing we neglect and often don't talk about, to turn our communities around, it's going to cost. And I'm not talking about monetarily. It's going to cost. I ask you today, are you willing to pay the price? And I'll stand first and be the first partaker of the fruit and pledge to you today and say, I am and I will. For the last 6 years, READI went through this rigorous evaluation, a RCT, and it was led by the University of Chicago Crime and Education Lab, one of our partners, at Heartland Alliance. And the person, one of the people that led this particular research project was none other than a dynamic young lady. And the thing I love about Dr. Bott the most is she went in with the intentionality to be people-centered, to focus on the needs of the people and not just examine them and bring about results. So at this time, could you please help me give a warm applause to my sister who is a researcher, but is a beautiful person that's devoted to this work, none other than Dr. Monica Bott.
Good morning, everyone. It's such an honor. Oh, I'm a little shorter than Dr. Tillman. It's an honor to be here with you today, and I look forward to sharing a little bit of what we learned in Chicago that hopefully can be the starting point of the work that we'll do together in the years to come. So I think we're here because everybody in this room knows that we've seen an increase in violence. And something that Dr. Tillman mentioned is incredibly important, which is that this increase in violence is driven entirely by gun violence. And it's important to name that, and I think what's really remarkable about this center and this moment in terms of CVI investment is that we are naming that it is gun violence and that we're focused specifically on shootings and homicides. And I'll come back to that specificity in a minute and why it's so important for us to make progress. I think to date, our policy response to this increase in violence that we've seen before, and in gun violence in particular, has unfortunately exacerbated the harms for the very population of people, young men in particular, who are bearing the brunt of gun violence. And so our response to this victimization from guns and of shootings and homicides has actually worsened the issue for the very people that we've been trying to help in theory. And so I think it's really important, one of the reasons that we're here today gathered in this room is because we're looking for alternatives to that dominant policy response. What can we do that's not going to exacerbate those harms for the very people that we're trying to help? And we've been here before, unfortunately. So in 2016 in Chicago, we saw an increase in homicides that was 60% of what we had seen in the year prior, and it was the largest spike that we had seen to date. And unfortunately, that trend has sort of continued, even though it abated slightly over time. And questions that people were asking then are similar to questions that people are asking now. What can we do? What can we do that it will not exacerbate the harms to the populations and the communities of people that we are trying to help and support? What can we do that will be very effective? And I think one thing that we sincerely believe is that the lessons we've learned in Chicago can translate elsewhere, and that's because Chicago is not an outlier. Chicago is actually in the middle of the pack in terms of our homicide rate, and we hope that what we've learned in Chicago can actually inform other cities. A lot of the cities you see on this slide are represented in this very room, and the hope of the center is that we can take the lessons that we're all learning in our unique communities and share them so that we can make progress faster. So this is a little bit of story of what we learned in Chicago and how we got to this place today. So I want to take us back to 2016 when this unprecedented spike in violence happened, and think about what we knew at the time, because this is really a matter of building the field. What do we know? We knew that there was a service gap for the majority of shooting victims, which is to say that the majority of shooting victims were actually over the age of 18, and the majority of programming that existed were for young people under the age of 18. And so there weren't a lot of services for men over the age of 18 that we could go to that were specifically meant to reduce gun violence. And again, that specificity of the outcome and the aim of the programming ended up being a really important thing in our context in Chicago, and my guess is for many of the other contexts that are represented here in this room. So what do? We know that we need to be targeting men who are over the age of 18. We know we want to be targeting men who are at the highest risk for gun violence involvement. And it was an open question at the time whether we could do that and whether we knew how to do that. The other question is, once you identify the target population of who you want in your programming. What should the programming look like? What do you actually do when faced with an individual who is going to pick up a gun, who has picked up a gun, who might pick up a gun in the future, and be involved in gun violence? And one thing we knew from prior work that we had done in Chicago and elsewhere was that interventions that help individuals stop, think, and de-escalate a situation instead of sort of escalating it over and over again can be really effective at promoting behavior change that reduces gun violence in particular. And we knew this from some prior work we had done with young people. We knew this from some of the summer jobs programs that we had studied. And then we did a similar intervention in the juvenile detention center and saw consistent reductions in violence. And mind you, this wasn't specifically aimed at gun violence, but this was sort of violence involvement, and so that seemed really promising. The other thing, and the other piece of information that we had, was that when you pair these interventions with conditional cash transfer or employment, they can be even more effective. So one of our colleagues, Chris Blattman, did a study in Liberia with former child soldiers who were trying to reintegrate into society. And when they had studied the sort of treatment arm of just this cognitive behavioral intervention versus just employment or a conditional cash transfer versus the combined intervention, they found that that combined intervention actually yielded the largest effects. And what's really remarkable is that 10 years later, they did a follow-up, and they found that the effects were sustained, and they were quite large. So this is all very promising. We didn't know the follow-up piece just yet, but it still remained promising at the time, back in 2016. And so we tried to get all of this information and put it together and work with Heartland Alliance, the 7 community partners, and say, how can we put together all of the pieces of information we know from research, but also the incredible amount of practitioner information that we had amassed on the ground, and put it together to develop a program that we think has hope to, 1, target the right individuals, and 2, provide effective programming. And then I think a third thing that we did, which was really remarkable, was that we didn't know whether this approach would work. We had some evidence to inform our decision making, but it's never a surefire bet. And so we wanted to make sure that we were learning systematically so that 5 years later we could stand in this room and share what we've learned, again, so we can make progress faster. And so we came up with this program model that was what we called at the time CBT in jobs, but essentially which was a lot of interventional programming for de-escalation and for sort of group-based counseling combined with employment, in which people had sort of supported work opportunities through 4 stages and could sort of practice some of the skills that they were learning in the morning sessions. And so we were able to set it up as a randomized control trial, which Chico mentioned. The participants would come in. Importantly, it took the street outreach workers about 2 months to find the guys. They were sort of identified through a variety of different referral pathways: street outreach, institutional partners like the Cook County Jail and IDOC, and then also through data. So we were able to use data to try to identify those individuals who are at the highest risk for gun violence involvement. Again, there's that specificity because we were really clear on who the target population was. And then they had the opportunity to participate in 18 months of CBT and jobs and up to 6 months of supported work. So even the development of that program model, I think, was really remarkable, not because we had all the answers, but because it was a coalition of civic leaders, philanthropists, practitioners, and researchers bringing the knowledge that they had at the moment to the table in response to this really unprecedented spike in gun violence. And I think that process is just as important as what I'm going to share with you next, which is what we learned. Because hopefully that process can be replicated in cities across the country. So what did we learn? We set out to try to answer 3 questions. The first is whether we could identify men who are at the highest risk for gun violence involvement. And it was an open question at the time. There was not ever this sort of specificity of who the target population was for this kind of programming in the past. And I think we really had to come together to understand what our definition was. How do you know? How are you going to sort of measure that and keep track of that? The second question we had was, can we engage individuals in an initiative like READI? Just because you build a program doesn't mean that people will come. And so it's important to understand whether that metric of engagement is sort of a sign that this is an authentic program that is going to be meaningful for the individuals that you're trying to help and support. And then finally, we wanted to understand this very important question of whether it reduces violence involvement, and again, very specifically, gun violence involvement, shootings and homicides. So in our study, we've got about 2,500 men across 3 different community areas on the south and west sides of Chicago. The programming was, again, run by 7 community partners, and we worked with each of them over a period of time, not only to design the program, but then also to sort of make sure we were able to understand how individuals were referred into the program. And we set it up as a randomized control trial. And this is really important because then we know exactly what would happen to individuals if READI didn't exist. They were able to access all the programming that already existed in that CVI space in those communities, just not READI Chicago. And what we found was really extraordinary. So prior to entering READI, over a third had been shot themselves. Most had lost a loved one to violence. Most were fathers. About 60% were fathers. And we had about 17 average arrests in the group of 2,500 men, about 5 felony arrests. What was really striking and remarkable was that through these 3 different referral pathways, when we looked after the point of referral, so not just before at baseline, but after the point of referral, over a period of about 1.5 years, we were able to understand what happened to men who were sort of not participating in the program, but were in the study. So what would happen if READI didn't exist? And the amount of violence involvement that these men experienced was staggering. So the average age of the participants was about 24. And we found that men who were sort of identified for READI Chicago programming experienced rates of shooting and then homicides that were 54 times the average Chicagoan, and even 11 times those individuals living in the same neighborhoods, and 3 times those men who were of the same age living in the same neighborhoods. And the reason that's important is because that specificity of who we're targeting with such an intensive intervention ended up being really important to make sure that the resources that were made available were going to the people who might need it most. And I think that's something that we learned in the city of Chicago that we can do with this combination of institutional partners, street outreach, and data that hopefully can be replicated elsewhere. We also found that men came to the program. So about 50% of men participated in the program, which is comparable to other programs that we've done, even in school and settings where it's a lot easier to get to the program. A lot of the men in the program had to overcome incredible barriers just to even get to the job site or to the CBT programming in the morning. So the answers to the first 2 questions were, yes, we can identify who is at highest risk and develop some metrics around that. Yes, there's an interest in sort of engagement in this kind of programming. And so then the question is, does it work? So here's what we saw in the actual program in terms of the counts. We were very specific about the outcomes that we wanted to understand. We wanted to know, does this make a difference for shootings and homicides, both for victimization and arrests? And then does it sort of decrease other types of serious violence involvement that might not involve a gun? And what you see here is that we see 12 fewer shootings and homicides for men who were offered the chance to participate in READI, and we see 14 fewer shootings and homicides. Those are lives saved due to READI programming, which is incredibly important to be able to sort of systematically know, because what we care about is, if you did this again, would we get the same result? So this is what happened in the actual time of programming during the point of the study. What we want to know as researchers, as practitioners, as community members, policymakers, if we did this again, will we get the same result? And that is something that we want to know with a high degree of certainty. If you go to the doctor, you don't want to know that a few people got this, prescription or medicine in the past and it worked, but it might not work again for you. You want to know with certainty that if I take this medicine, I'm going to get better. And that's the thing that we're all aiming to understand. When we put all of these outcomes together, we actually see some suggestions of a reduction for the men who were offered the treatment in READI on the left and the actual participants on the right. But that band shows that we're not exactly certain. We don't know sort of definitively whether all of these outcomes put together for victimization and arrests went down. We think that they did. But What's really, really remarkable here is that specificity. So when you disaggregate the shootings and homicides, and when you look at arrests in particular, you see this huge reduction in shooting and homicide arrests. And that's really, really important to know and to understand. And as policymakers, oftentimes you don't have the luxury to know something definitively because you all are making decisions all along the way. And so I think one thing that this tells us for the work of the National Center is that policymaking should be evidence-informed, but in the absence of evidence, we need to make sure that we're doing values-based policies in a way that we can learn from moving forward. And then one other thing that I think is really remarkable is that of the three referral pathways, street outreach, the sort of data-driven referral pathway, and the institutional referral pathway, we see the strongest effects from the street outreach pathway. And we see really definitive sort of results here to say that the shooting and homicide arrests in particular go down by almost 80% in that pathway in particular. So again, this is important knowledge that we can share with you all that hopefully will inform the work of the center moving forward. Importantly, this is one study, and so we should build on, I think, the information that we've learned here, because one study is not going to make a field. We're sort of building the field of violence prevention, research and evidence together. And the point is not to just have a sort of field of research that stands unto itself, but to know definitively when you have a spike in violence, what to do and what strategies are going to work for which individuals. Importantly, we see that this kind of approach does have incredible cost savings. And so when we're really conservative about what the sort of cost-benefit analysis is, we see savings of 3 to 1, but when we're more inclusive and we think about things like businesses moving into an area or the sort of psychological effects of community violence on kids, we actually see savings of $850,000 per participant for this intensive program. And I think that's really important and interesting to know as well, because the argument that this is an intensive or expensive program is debunked when you think about the sort of good that can come of it. And then the last thing I'll say, just to the policymakers who might be in the room, is that the important takeaway here is that this is the first evidence that we have been able to generate that is sort of definitive in this rigorous randomized control trial framework on looking at gun violence as an outcome in particular that shows that this sort of non-law enforcement approach can lead to reductions in gun violence and shootings and homicides. That's incredibly important. But we're not going to know with a high degree of certainty unless we keep doing this again and again and we keep learning. Does it work in different contexts? Who does it work best for? And that, I think, requires learning and understanding in addition to sort of capacity building. And that's why I'm really excited about the launch and the sort of work of the center moving forward. So hopefully this information and what we've done in Chicago provides a little bit of context of how we got here today and the kinds of ideas that are circulating. I think one very important takeaway for me personally, having been involved in this work for the past 5 years, is that it could not have happened without every single sort of individual and role in Chicago striving to help and support this population of individuals involved in gun violence from their vantage point in the best way they knew how. And so Dr. Tillman said, you know, we can only do this together. And I do firmly believe that's true because we've got this sort of proof point from Chicago. So thank you so much for your time today. I look forward to talking with many of you later today. And with that, I'm going to pass it over to Dr. Tillman, who's going to introduce our first panel where we can talk about some of these ideas.
That's a little better. Y'all got to loosen up a little bit because I know most of y'all. I know this group. So y'all can't be all stiff and stuff because, you know, we really family when you think about it. The beauty of working in this space is many of us know each other. And I was telling somebody, trying to explain our work is kind of complex. Especially, you know, when you're trying to explain to a family member and you at a function, why you getting calls? You ain't at work? Why you getting calls at 10 at night? What's going on? And you say, well, I know I'm not at work, but, and they really don't get it. But, so it takes a special type of person to do this work and be committed to this work. And that's why I'm so enamored and crazy about each one of you, because of the level of commitment it takes. And even sacrifices in terms of with family. You know, I got to step away for a minute because I got to do this, because we know the power of our work is us jumping on a phone call or us helping a person work through a problem can eventually save somebody's life. And that's the difference with what we do. And I often refer to these people in this room as superheroes because we put everything aside to save not only our communities, but humanity. Do me a favor and give my sister Monica a warm applause for the work she did. She did a great job of giving us this framework of what the research looks like in CVI. And next up, what we're going to do is have a panel of experts, of brilliant people from all over the country in different spaces, talking about the science and the data around CVI and trying to inform and educate us in a way, that way we leave here with something and be a little bit sharper, and we could take it back to our organizations and community. Please welcome our panelists and the moderator. First, we'll start with our moderator, Walter Katz, the Vice President of Criminal Justice at Arnold Ventures. Next, we have Daniel Webster, the Director of the Johns Hopkins Center for Gun Policy and Research. Next, we have Rosanna Ander, the Executive Director of the University of Chicago Crime Lab and Education Lab. Next, Michael Sean Spence, the Senior Director of Community Safety and Initiatives at Everytown for Gun Safety Support Fund. And lastly, we have Barbie Robertson, the Executive Director of Public Health for Harris County.
Good morning, everybody. All right, it's on. Chico, thank you so much, Dr. Tillman. Thank you so much for that warm introduction. And again, good morning, everyone here in this amazing historical space, the Howard Theater here in Washington, D.C. I'm Walter Katz. I'm Vice President for Criminal Justice at Arnold Ventures. And we're going to talk today about the work that we do. We'll talk about data a little bit here and there, but I think we have a lot to talk about. Quick synopsis, though. I just want to do some level setting and build on what we've already heard this morning. And the ultimate question is, how do we respond to the 18 to 20,000 homicides that happen every year? Of course, we saw a surge in violence in 2020 that remains elevated. A higher proportion of homicides are due to gun violence now, more than ever before. We know that violence is concentrated in communities that have been marginalized and disinvested for a century or more. They have few of the protective layers that can buffer the effects of violence exposure, such as access to quality education, access to jobs, youth development experiences, living wage economic opportunities, stable housing, affordable health care. All those things are less present in the very communities where violence is concentrated. And thus, due to these historical and contemporary structural racist and concentrated disadvantage structures, Black and Latino children, young adults, and families are disproportionately exposed to the consequences of violence. Of course, this is not new. Black male children and adults aged 15 to 34 have been dying of gun homicides at a rate that is at least 17 times that of the overall U.S. population. Well, gun homicide has been the second leading cause of death for Latine male children and adults aged 15 to 34 for well over 20 years. The homicide rate for black boys and young men increased by nearly 40% in 2020. So there's a growing recognition of the value of community violence intervention that it can bring to communities, but not only identifying, reaching, and intervening in escalating and potentially lethal situations prior to the violence happening, but also changing the life path of individuals at risk of either perpetrating or becoming victims of violence. So that's really what we want to talk about today. At Arnold Ventures, we've been very focused on asking the questions about what is effective community violence intervention and what does it look like. And very recently, we published or introduced an RFP. The response we got from researchers in answering those questions was really heartening to really suggest that we are on the right path. But today, I want to really have a focus on what all of you are doing. And I want to kick us off with a quote from Dr. Shawnee Buggs from the University of California at Davis, who said that for cities and counties around the U.S. to see meaningful and sustained reductions in community violence, community-based violence interventions must be viewed as an essential element of community safety and integrated into city or county public safety plans. Barbie, I'm going to start with you because you're in the middle of it in Harris County as the Executive Director of Public Health. Tell us about the work that you're doing in Harris County, even if you want to tie it a little bit into the work you did before then in Sonoma County, California, about how you're tying together public health into violence intervention strategies.
Good morning. Good morning, everyone. Can you hear me? It is an honor to be with you all today, such esteemed experts in the field of community violence and public safety. In Harris County, we view violence as a public health crisis. As we've developed our programs, we see them as a complement on the continuum of public safety initiatives and interventions and resources that are available to the residents of Harris County. We recognize that we are going upstream, whereas our law enforcement partners are reacting to violence. And we really want to take approaches that get to the root causes. What are the root causes of violence, right? What are the social determinants of violence? We often talk about the social determinants of health in the public health space, but we also want to make sure that we're focusing and centering on, as it relates to violence prevention, looking at the root causes and the determinants of violence. And they're the same, right? And so in Harris County, we've stood up our community violence intervention programming, not just focusing on how do we get to those that are most vulnerable, but how do we change their life trajectory? It is so important. I do not want anyone in this room to think that we're diminishing the importance of interrupting and preventing an incident of violence, but how do we systematically sustain that effort and set people on a different life trajectory? So we've established an initiative called Access Harris County. Access stands for Accessing Coordinated Care and Empowering Self-Sufficiency. That model brings together all of our safety net providers across systems, the frontline staff, so eligibility workers, social workers, mental health clinicians, public health nurses, primary care providers, housing navigators, and we wrap all of those services around individuals that are participating in our violence prevention programming to help change their life trajectory. So in addition to the services around intervening and disrupting violence, we also begin the process of helping them get on a new path in changing their life in terms of disrupting the trauma that has occurred in their life. So that is really, in a nutshell, our model in Harris County.
Now, you and I talked about this a little bit yesterday evening. I was really fascinated in how data is being pulled together, administrative data is being pulled together from these various parts to get a better picture of the people who are at risk. Can you tell us a little bit about that?
Yeah, so I think for me, I know I'm in the room with a lot of researchers and I value all of the work that you do, But data has to live, it has to be operationalized, it has to be used in real time to inform the work that we're doing. So we created an integrated data hub where we pulled the data from all of the source systems from the safety net providers, so mental health data, substance use data, housing data, some safety data, primary care data, and we put it into an integrated data hub, and we have these care coordination teams that are multidisciplined. That data then is pulled, key pieces of information about the individuals that are participating in the programs. That data is pulled into a virtual client record that provides a 360-degree view of who these people are, the services they need to help inform those providers. Because, you know, we know that we have some insight in terms of what's happening in someone's life from a violence prevention perspective when we're engaging them and building trust. However, we need that holistic view so that we're able to provide a holistic wraparound model of service delivery for those individuals. So we are using data to drive the decision making, and I want to get this plug in. I want to make a call for all funders that are in the room. I was at the federal level for 15 years as an associate regional administrator at CMS, and went to the local level and realized, right, that the feds have all the money, states have all the power, and the locals have all the challenges. And we're on the ground doing the work. And what gets funded often doesn't allow us to build the infrastructure to collect data, to use data in real time to inform our programming. The data hub that we created in Sonoma County first, which I left the feds and went to Sonoma County in California, the data system informs how we do the work on an individualized basis, but it also allows us to understand the types of services that people are utilizing, how to improve those services, how to improve service delivery across the continuum. So I just wanted to plug that. Thank you for allowing that.
I really appreciate hearing that level of detail. Daniel, as director of the Johns Hopkins Center for Gun Policy and Research, and I wrote that down so I wouldn't get it wrong, okay, because there's so many centers. I want to hear about the work you're doing, and particularly you've done some really fascinating work, for example, focused on Baltimore. As a researcher, as you see that interrelationship between community violence intervention, what are you learning and how it's being applied in a city like Baltimore? And the second part to that, how that interacts with what, for example, the police department is doing.
So, first, I just want to say what an honor it is to be part of this group. I'm just so excited about everything I'm hearing now, what you're doing in Harris County and that amazing work of READI. So I've been studying community violence intervention in Baltimore since 2007, so it's been a long haul. There's been a lot of changes to actually a pretty, honestly, a basic model, one that we generally think of in the brand name of Cure Violence, outreach and violence interruption. And it's and there's been sort of literally ups and downs with what we're seeing in terms of program effects. And so there are some communities where very soon out of the gate, I was really stunned at how quickly homicides and shootings went down with the right kind of people and focus. And I've also observed the opposite, where things really have gone wrong. And so we've had individual sites and individual periods of both great progress and also stagnation. And one of the things that I've done over this, you know, I'm mostly a quantitative researcher. I do some qualitative work. But some of the qualitative work that we've done actually, I think, has been the most enlightening of thinking about what violence interruption is, what the challenges are, how it sort of works or doesn't work systematically. And so one of my doctoral students did in-depth interviews, focus groups with the violence interrupters, both in Baltimore and Chicago, and learned, one, they're actually quite dependent on law enforcement doing their job. If law enforcement is literally failing those communities, it is so much harder to do violence interruption. So that's one
thing that I took away, and I think eventually there started to be more information flow, again, varying over times and administrations, from police to actually tell the interveners, like, hey, this could be useful to you. We're sort of in the same game of trying to have fewer shootings. Again, what we're searching for is more sort of buy-in and system orientation. And, Dr. Tillman really sort of set the stage with us how we should be thinking about this now. It's like, I love a good demonstration project. Okay, I've done them, I've published them. We now need to think about systems. Are we creating systems? And I think Baltimore struggled a little bit with that. I think it's certainly the mindset. The mayor wants to do that, but it's a challenging thing to do. And so I guess, again, I think we've brought, with some of our quantitative research, we've been able to illuminate when things are going well or not, and at least some hints of why. But it's really what we learn from the people doing the work that really kind of takes it to the next level. And that's sort of, I'm hoping to do some work here in the District of Columbia that really blends these two, the rigorous quantitative analysis with the information from people doing the work and the people they're working with. So that's what I think is sort of the general model, is sort of learning. This actually, UC Crime Labs, Dr. Bott did a nice job of sort of the basic recipe for innovation is research and community on the ground. And that's sort of how I think we should be thinking of these.
Tell me a little bit more. You said earlier about that in Baltimore, there were these ups and there were these downs. Having been on the mayor's office side, I know how hyper-responsive one is, just literally to the last weekend. Right. And there's not a lot of time put into understanding the whys behind the ups and downs. What have you learned in trying to understand how you see an impact occur in one community or one neighborhood, and a couple neighborhoods over, there's no impact whatsoever, or it's going up? Have you developed an understanding of the why behind that?
I want to be humble here and say I'm still trying to figure it out, but I think I have some decent ideas. Again, because I've been doing it since 2007, it's a slightly different story over that time. Because, and this is maybe the most important message I want to sort of convey here, is that the basics of violence interruption, those models were developed in the 80s and 90s. Things are very different now. And so some of the things we learned early on that were really key to mediating relatively large groups who were, at it with one another, I don't know how relevant that is right now in terms of what the violence looks like. Less of it is about drugs than it used to be. So there's a lot of things that we have to keep evolving, and that's why, I really salute what Harris County is doing and others when they have a process of gathering that data in real time with different sets of eyes, law enforcement, community, researchers, to really put this puzzle together and hopefully modify the interventions accordingly. Because I feel like we get a little too rigid here in thinking about, wow, look at this successful thing we did literally 15 years ago. And what does that tell us right now? I'm not sure, to be blunt.
Right. It's like when for years and years the Oakland Raiders football team would say that they're the winningest professional sports team in existence, and they hadn't won anything for a decade. So Roseanne, data is not static, right? But I think we're hearing this from both our guests so far. Tell us a little bit about the role that, as we start talking more about data in this conversation, that universities can play to help collect and unearth data, unearth trends. Tell us a little bit more about, just for those who don't know, the role, for example, of the Crime Lab in that work in the city of Chicago.
Great. Let me add my thank you to Dr. Tillman, to Evelyn Diaz, who's the President and CEO of Heartland Alliance, and to all of you who do the really hard work. I know that the job that I have doesn't come anywhere close to the challenges that all of you face doing the work that you do. It's a privilege to be able to partner with many of the organizations that are doing the hard work. And to your question, Walter, I think that I hope that what we're trying to do, and we are far from a perfect organization or example of this, but is to try to be in service of those who are on the front lines doing the work day in and day out. When we started the Crime Lab back in 2008, one of the things that we said and really observed was there's not a lack of innovation in communities that are facing the greatest burdens of gun violence. They are constantly innovating and working tirelessly. What has been lacking is the ability to really document and measure the impact that those efforts are having in ways that will be persuasive to policymakers and funders so that we consistently invest in the things that are making the greatest difference. So, our goal and aspiration when we started the Crime Lab was to work directly with those frontline practitioners, those nonprofits, and the public sector to co-produce that evidence so that we can see greater resources going where they're going to make the greatest difference. And I think that, I think researchers who want to be in this space really need to come at it with a sense of service and not just about advancing their own careers and publishing papers that other academics will be impressed with. I think there are all kinds of incentive problems in academia that actually are an impediment to doing this work well, and I think there's things that need to change in the academy so that we can have more researchers rewarded for and incentivized to do this kind of work, which I think is desperately needed. And I think that a university does have incredible resources that should be brought to bear, but it needs to be done in partnership, not with the researcher coming with all of the answers, but really kind of working together to define what are the questions we need answered, what are the right methods that we should be using to answer those questions, and then how do we share that back first and foremost with the practitioners doing the work, with policymakers and with funders. And I think we've tried to be an example of doing that. I think READI, it was one example. I think there are others. I know you're familiar with another partnership with a couple of organizations that work with a younger population in a program called Choose to Change, which has some of the core elements that READI has. But again, it has to start with the goal of we want to try to make things better in the communities that are bearing the greatest burdens and the greatest systemic failures, and be willing as a researcher to recognize that you don't have all the answers, and frankly, you probably have more to learn than the people that you're working with.
Well, and I just want to take a moment to publicly and personally thank you, Rosanna, for being there for me and for the city when I was in the mayor's office. For those who don't know, the City Hall in Chicago is directly across the street from where the urban labs are. And for me, being able to pick up the phone or walk across the street for us to have conversations about the challenges that were going on, what we could learn from the research, was an invaluable resource for me and thus for the city and for the mayor as well. I really want to thank you and appreciate you for the partnership.
We miss you in Chicago.
Well, we'll talk about that later. Take us through a little bit, I want to follow up a little bit, about how the Crime Lab then worked with Heartland Alliance and READI to build the data capacity. Because we're going to talk about data capacity and those challenges for quite a bit. So I want to start with you about how you did that work, or how Crime Lab did that work with the partners.
Well, first of all, I think it took a set of organizations that were deeply committed to trying to have impact. I think, our city was in crisis in 2016. We, as Monica said, had a 60% surge in homicides and shootings over the course of 1 year to the next. That literally meant 300 more people died in 2016 than in 2015.
755 homicides in 2016.
Exactly. And I think we really wanted to figure out what we could do right now. I think there are lots of really important long-term things that need to happen to really help support the communities that are bearing the burden, but what could be done in the very near term to directly sort of break that cycle of the gun violence. And I think it required working with organizations that were really committed and also came to the table with a level of humility and, with ideas about what would help, but a willingness to look at the data that we could amass in real time. Just as one example, I think Heartland Alliance did a great job of identifying the right partner organizations to deliver the interventions in the communities that we were working with, but also to cultivate a culture of learning across the different organizations. And I think the data can play a really important role in holding up a mirror to the program providers of who they're serving. Are they actually reaching the individuals that we're intending to serve? Are we getting the kind of consistent take-up and participation? Can the different partner organizations learn from each other? Because if one of the community organizations is doing a really good job consistently finding and engaging the intended population, what are they doing differently? So I think there was something that we developed called READI Stat that was, and I was not directly doing this. If anybody who knows me, I can barely add 2 and 2. So I was not directly involved in any of the data work, but the team was, and to create these monthly meetings where the different partners came together and looked at a set of metrics and some shared goals around what is it that we're trying to accomplish, how are we doing, because we knew with READI this was all of our collective best guesses as to what could be helpful, but we didn't know. And so we wanted to have the freedom and flexibility to tweak and adapt and modify the program. And so, again, I think many researchers would come into a project like that and say, whatever the program is, you can't change it because, there's all kinds of challenges with the validity of the evaluation if you're making changes to the program. And our priority was to try to help have an impact on gun violence. Learning something was important, publishing a paper was important, but the number one priority was to try to do something meaningful in our city. And so being able to leverage the administrative, as a research organization, we're able to get access to public sector data. I'm so impressed. I want to come to Harris County and learn more about what you're doing. It's just extraordinary. But that administrative data that the government has can be such a powerful tool when provided back to researchers and providers that are doing the work. And so to be able to tap into that and use it to inform program design, and all kinds of other things. But, it really did take a set of community organizations that were as committed to trying to deliver the best quality program as we were trying to learn. So it was a real privilege to get to do that. But I think there's a lot of power in that data, but it has to be reflected back by those who are doing the work on the ground, because they had all kinds of insights that we wouldn't have had if we just looked at it ourselves.
Well, let's talk a little bit about doing the work on the ground. And Michael, Sean, good morning. And I'd love you to describe to the audience here what every town is doing, what you specifically are doing in terms of capacity building of these organizations who are trying to save lives.
Definitely, and good morning. And thank you again to READI, to the Heartland Alliance family for inviting me to participate in this esteemed panel. I've been in the public safety space for 15 years, but I never take it for granted when I get to sit next to and in front of such bright minds, all of whom are dedicated to crafting a safer tomorrow today. So I want to thank all of you for having me. As you mentioned, and as many have mentioned, we are in a unique time. And I'd be remiss if I didn't echo what was shared at the top of our convening by Dr. Tillman and by Dr. Bott, that we are in the midst of a 2-year surreptitious incline in gun homicides and shootings, which have created a tragic environment in many of our black and brown communities, city by city, big and small, coast to coast. Cities which have experienced a 37% increase in homicides in 2020 and persistent gun violence ever since, requiring that we treat this as the national public health crisis we all know it is. And fortunately, community-based violence intervention programs, many of which are represented in this room, have been doing that for decades. They know firsthand that their programs are intel-led, smart, effective, evidence-informed, and know their communities better than anyone else. But unfortunately, due to the dynamic times we're in, there is an urgency of now. An urgency of now. So what every town tries to do is meet that urgency in a couple different ways. And I have to note, we could not do it without the partnership of many in this room. Marcus McAllister, Erica Atwood, Greg Jackson, Norman Kerr, Reggie Moore, I think I saw in the room, and so many others who not only participate in our programming, but more critically inform our programming, which is the starting point for any progress in this space, being informed by the field, being informed by our prized practitioners who are on the front lines day in and day out, street corner by street corner, working to intervene and prevent the next shooting from ever happening. And when we talk to them, we learn something very similar from each of them, which is that more is being asked of them as they continue to respond to increased violence. They're expanding their mandates. They're engaging new communities. They're expanding their program outreach to more program participants, and that requires real, sustained, strategic investment. And not carte blanche, investment in expanding the evidentiary basis. Dr. Bott did a great job of sharing much of the rigorous analysis that's been done in this space over time. In the last few years, there are great examples. In 2016, the analysis of the hospital-based violence intervention program in San Francisco, the wraparound project, From 2005 to 2004, they experienced a 4.9% re-injury rate compared to 8.4% from 2000 to 2005, not only slashing it by almost half, but then sustaining it for a decade. The 2017 analysis of cure violence in the Bronx as well as in East New York showed declines not only in shootings but in victimizations. 37% decline in shootings in the Bronx, 50% decline in East New York. More recent analysis of crime prevention through environmental design efforts in Philadelphia showed that when they targeted communities that were below the poverty line, they had a 13% reduction in shootings. There were also the ancillary benefits of folks feeling more comfortable in their communities, wanting to engage their community members, and creating that community fabric that bolsters their resiliency to future harm. We know that these strategies work. And our frontline practitioners, anecdotally or qualitatively, have affirmed all of these lessons learned. They know it firsthand, but they know something more important. They know that not only can they be effective, they can sustain that effectiveness when they are resourced, well-resourced, to add to that evidentiary base, to access real-time data to inform their strategic deployment of their resources, to deepen their understanding of their workforce as well as their program participants, to further tailor a nuanced approach to, as was mentioned earlier, change the life trajectory of the most vulnerable amongst us. So how does every town do that? We do that in a number of ways. One, we provide direct investment to community-based violence intervention programs who are on the front lines of expanding their programs, their missions, their mandates, their footprints in cities that need their help, more today than ever. We've supported 72 programs in 57 cities since 2019. And that's with the guidance of folks like Marcus McAllister, Anthony Smith, who I think I see over there at Cities United, and others who participate in our advisory board and inform our strategy as well as our investment. Erica Atwood, you're on our advisory board too. I see you. Greg too. I could keep dropping names, but without them, we couldn't do this work. Furthermore, it's more than just a check. And yes, we do provide financial investment, but we provide access to subject matter expertise, capacity building that helps them define their metrics and outcomes, to then measure against those outcomes, developing logic models, creating data-informed narratives to help them in their resource development and their grant applications, accessing public data. Recently, we surveyed 30 of our current grantees, and as was reflected initially, 80% of them reported that they rely on a local city agency for public data to inform their grant applications so that they can seek out the necessary funding to sustain their work. Fortunately, we're helping them do that, and we're doing that in partnership with many of the folks in this room. But separately, we're also investing in strategic, hyper-local approaches. A great example is the work happening with the support of the Crown Foundation. I see Corey back there as well, in the North Lawndale community, a 3.2 square mile area where we're supporting a longitudinal analysis being led by Northwestern of an effort by 4 organizations that are working to increase staffing by 42 and increase outreach to 700 vulnerable participants over the next 2 years. That's the approach to cities with an existent, maturing ecosystem. But separately, in cities like Atlanta, where there's a nascent ecosystem, we're working with them collaboratively to identify and incubate CVI organizations that are ready for the fight ahead.
Well, let me ask you this then. We're talking about organizations, some of which have infrastructure, years of establishment. But I'm thinking, though, of smaller organizations. Let's say a couple of guys who have almost a mom-and-pop type street outreach work, working out of a van, let's say in Humboldt Park or Little Village in Chicago. And where is their capacity? What I'm thinking about is, a CVI organization, which right now is worrying that a foundation is bringing its funding to an end, which was about 75% of its budget, and having to worry now about laying off violence interrupters, the majority of their staff, because their funding has shrunk. Where are those small organizations which have been on the ground for so long, doing this work out of the spotlight? Where did they get the ability to build this capacity to do this data collection we're all talking about today?
In partnership with every town, with many of the folks in this room. You just described a number of our current grantees. I know many are aware of the situation that we just averted in New Jersey, where 9 HVIPs were looking at their funding ceasing. Not only did we work with them collaboratively to advocate to the Attorney General and the Governor of New Jersey to get bridge funding, we worked to provide some bridge funding ourselves. We work closely with programs like that. But then we also provide direct access to the experts and the national subject matter experts that are a part of our Community Training Institute to help provide long-term resource. I think earlier we mentioned this is hard work. And it's hard work because it's hard work, and that takes time. So providing that long tail, that long-term investment to not only allow them to meet the urgency of now, but then to build their capacity to sustain that work and to scale to more communities and more people in need is the work that's ahead.
Okay, thanks. Now let's tie this back now, this need for data, and tie it back to the relationship then between CVI providers and government. Harris County is a great example. I know that you're working with a number of different agencies. You're also working with Sheriff Gonzalez and his department and Harris County Sheriff. How does the work translate then to what the on-the-ground organizations are doing, the direct service providers? What is being asked of them to provide data, and how do you overcome some of the challenges they have in doing so?
Yeah, I think one of the key components is funding that allows for the building of capacity and infrastructure. I cannot emphasize that enough. In looking at funding, funders, right? I know it sounds like I'm picking on y'all, but the reality is we have to transform our definitions of organizational capacity and who are the organizations can do the work, because we continue to create squares when we need circles. And then we ask folks to put the circle in the square, and then it doesn't work, and then we evaluate it, and then we say, hey, this wasn't evidence-based, this didn't work. Evidence-based is dynamic, right? And so part of what we have to understand is that as communities change, as we evolve, we have to build the capacity and bring the resources to allow for that evolution of organizations. To that point, to your point, in the 80s, right, we're focusing on drugs, right? And so a lot of organizations, right, they didn't have a ton of capacity to begin with, right, the mom and pop folks, so they focused on that. And then we're now saying, okay, we want you to focus on these root cause interventions. And they're like, well, no, for the last 10 years I've done X. How do we help transform and set them up so that they're able to now respond to the ever-changing, evolving dynamics of violence in our communities? And so for us, we're using some of our workforce development dollars to build capacity in community-based organizations. And that's different, right? Most of the time, right, we get these federal grants and they're like, oh, go out and build your public health workforce, right? So you think epidemiologist. You think public health nurses. We're saying broaden the scope of that and allow us to build the capacity of community-based organization providers in the community violence space. And so that is how we're thinking about using our dollars. I will say grant funds are so important. My expectation is that local government, which is a more foundational, permanent source of funding, that we think differently about how we provide the funding to organizations, recognizing that those that are on the ground aren't often, the larger organizations in a community. They're not the ones doing the work that has the impact. And so I think the building of the capacity, sharing the data, having an integrated data hub, providing the funding and the training and the resources that are necessary for those organizations to submit the data is so critical. And that's the work that we're doing.
Well, thank you for that, Danielle. I'm thinking about conversations that you and I've had about where you've developed some innovative ideas, for example, in gun enforcement. And then we talk about, well, what sites or jurisdictions are interested in doing so. And the conversations we've had, and I've had with others, with Rosanna, for example, is how do you get policymakers on board to understand the importance of something? What have you found they're responsive to? Is it data? Is it political risk? Is it narrative? What have you seen?
Well, I guess my response is that, this is sort of lame, but it depends. There are sometimes you simply build a good relationship of trust, and it happens. I had a conversation yesterday with Ivan Bates, who most likely will be our next state's attorney for Baltimore City, based upon the report that you're referring to. And he genuinely just said, this sounds good, I want to do it. I didn't have to twist his arm. It just sort of was natural. The prior administration that came in, a little less trustful, and I tried to build trust in that relationship. But sometimes there are points in time where a public conversation is needed. I think you start with private conversations, but at some point you have public conversations. So the report that we issued in 2020, we were trying to facilitate the system changes for 3 or 4 years. We were getting nowhere. So we said, okay, we're going public with the data and our insights, and actually we did direct community surveys and focus groups from the most impacted communities that were central to what we were trying to get across, which is they were distrustful of the system. They needed accountability and transparency with data. And that's what we did. But, my hope is that you don't have to go through all of these hoops to convince people that it is in their interest and the community's interest to collect, share, and be transparent with your data, and recognize that, addressing gun violence in places like Baltimore is about the hardest thing you can do. And you're not always going to get it right, but you have to go into it with a sort of purposeful accountability and transparency.
Right. And changing course a little bit, and thanks for that answer about that challenge, is that my experience has been, Rosanna, that behind every data point there's a human story. And I'm most thinking about READI, and I think it was back in 2018 when Eddie Bocanegra invited me to come out to the West Side to meet with some of the men who are taking part in the READI program. And one in particular really stood out to me. He's a talented artist. He really was trying to develop his music career. But there was one big challenge about getting out to his transitional job, and that was remaining safe. That was concerned about having to cross territory which put his own life in danger. And so my question is that how, and I'll be broadening this up to everybody, how can we make sure that this conversation about data is actually a conversation about narrative? It's about those lives that we're trying to save, that we don't have it be so antiseptic that we're forgetting that what this is actually about, and how can we engage in that conversation and really impart on is it funders or the business community or policymakers of how important this work is.
I mean, I think it's an indictment on our country that we haven't made this population more of a priority, and we've let these conditions persist in plain sight year after year after year. We don't need the data to tell us that there's a crisis, but the data are human lives, as you said, and the very complex human lives, and we need to do a much better job of pairing the data that's collected with that context and that you know, that nuance that exists that really does humanize and help people who are not, frankly, spending time in these neighborhoods to understand all of the barriers that we have put in place that people have to overcome every single day just to live their lives. And it really does not have to be that way. So I think what I'm hopeful about with READI is hopefully we have really convincing data on where we're seeing impact and what's encouraging about it, but we also have tremendous, rich, qualitative information of the individuals, of the human lives, of the people, both in terms of the participants in READI, but the workers, the individuals who are doing this work day. Dr. Tillman did an amazing job starting to talk about the sacrifices that people are making. And so I think it's incumbent on all of us who are in the research community trying to do this work to not just sanitize the data or just talk about data and effect sizes and statistical significance, but to remind all of us why we're doing this, the lives that are at stake in getting this right. And I do think that there has been some pushback on doing really rigorous research in this space. And my kind of answer to that is these lives matter and we do need to get the answer right. We need to know what's working. And I do think that there is an important role for the kind of research that we were able to do with Heartland Alliance and with all of the partners. It can't just be best guesses. So we do need the data to know, to hold ourselves accountable and know what's working and to learn and to be able to continue to iterate. But we have to be able to provide that much richer context that really does, frankly, implicate the systems that continue to perpetuate these conditions. And so, you know, I think that there are all kinds of ways to do that, and we want to try to do that as we roll out the findings from the READI study.
Right, thank you. Michael Sean, to me it seems that the violence interrupter, the one who is out there on the street corner at 10 o'clock at night, they are the unsung heroes who don't get enough recognition. And the work that they're doing is at a great cost. And you and I talked about that earlier this morning. You know, yes, this is a data conversation, but the data points to this occupation is a traumatizing one. What can we do, be it funders or other stakeholders, to make their jobs and their lives more manageable?
That's exactly right. You know, one of the things every town is doing, as an example for others, is we are supporting research and researchers in doing that thorough internal analysis, not only of the program participants, but as Rosanna mentioned, of the prized practitioners as well, many of whom bring their own pre-existing trauma to the work, which is then further exacerbated by doing the work. One example is the research we're supporting Andrew Papachristos in doing. And the early insights have already been very, very informational. One, the average age of violence interrupters, at least of those who participated in their program, in that survey, I believe about 180 folks, the average age is 43. 60% of which have seen an attempted shooting while on the job. 32% of which have seen a completed shooting on the job. 20% of which have been shot at while on the job. That sort of internal analysis points to a couple quick indicators. One, it affirms what we just said, which is that this is incredibly dangerous, traumatic work. Additionally, that many of these individuals have a steely resolve and commitment to doing this work that will not allow that to discourage them from going out on those street corners. And that's why the urgency of now requires real, strategic, deep investment in sustaining that strength within us and within our communities, within these prized practitioners who, many of whom have been doing this work for decades without pay. And even those who are being paid are not being paid properly. Many of whom who have no death benefits, yet they're exposed to that risk day in and day out. Real investment in the livelihood of these individuals, really humanizing the impact that they are posed, that they meet every single day. You asked a question prior about what resonates with funders. In my world, where I talk to donors, it's the human aspect. It's talking about Anthony Smith and Marcus McAllister and Reggie Moore and the people who are on the street corners and who are engaging folks in city after city after city after city, thinking about the next city they're about to go to. That's how we move the dial. That's how we resonate. It's deep investment in the resiliency of the folks who have this steely resolve that can't be abated.
Thank you so much. So, last question.
Walter, could I just
Yeah,
add
please.
one?
We have about 5 more minutes, so please.
Thank you. I appreciate that. I want to note when I said, when I talked about Baltimore's experience with safe streets, and there were some lull periods of not doing well. Not coincidentally, that was a period of time, and I believe it lasted 7 or 8 years, where the workers did not see any increase in pay for like 8 years. When we had breakdowns in one of the sites, 2 of the workers were living out of their car. Another worker had to leave the work because of the mental trauma that he was experiencing. Baltimore had 4 workers murdered in a span of 14 months. One of my friends, Dante Barksdale, was one of those. So this is really important, and to get to your question about sort of how do we tell those stories, I just, if you don't know his work, I'd really encourage people to check out Joseph Richardson's work, a brilliant violence researcher who is now, you talked about accessibility of data and research. He's created an incredible documentary, award-winning documentary, based upon his research with the people impacted. So Joe and I put together a proposal for DC that integrates, one of our products is going to be digital storytelling, as well as the quantitative data. And it's going to come from these workers and the challenges that they're facing that's going to push innovation and accountability in the system. So I'm sorry, I just
that's
take you
great.
off course there.
Well, no, not at all. So we only have a couple minutes left, so I'd love to go around the proverbial table and put on kind of like take out your crystal ball and like to hear from you what you'd like to see happen over the next couple of years, either within the work that you're doing, let's say in Harris County, about what is the North Star that you have in your mind over the next couple of years. Barbie?
Yeah, I think the North Star for us is outcomes and not outputs. We talk a lot about getting people into the safety net and not so much about getting them out of it to greater well-being and self-sufficiency. So for me, the North Star is the participants in our programming, that they're able to get the housing they need, to heal some of the trauma that they've endured in their lives, to have a livable wage, a job that pays a livable wage, supporting their children, right? Disrupting that generational curse, if you will, of violence and trauma in their own family. So for me, making sure that our systems are accountable to that local government is on the ground. A lot of the funding and opportunity and establishing of the North Star comes from local government, and holding that responsibility in the highest esteem and being accountable to it.
Thank you. Michael Sean?
A couple things come to mind. One, building the capacity of CVI orgs, which are already critical to a comprehensive approach to reducing gun violence, so that they can sustain that work and expand to more communities. Second, building ecosystems that can also support and bring groups together in cities so that they can share lessons learned, best practices, and common barriers. And then lastly, ensuring sustained long-term investment at all levels of government, federal, state, and local. not only to ensure they can be sustained in the short term, but also to provide continuity of care, particularly for the most vulnerable folks, post-discharge from hospitals, post-intervention after shootings have been stopped. But because we know, although the hurt may stop, the healing continues, and that's long-term work.
Thank you. Rosanna?
I love both of those answers, so I won't repeat them, but we're supposed to be a country and a government of the people, for the people, by the people. For too long, we've been a government that's for some people, of some people, et cetera. I would like to, as it's demonstrated in terms of outcomes, that we are really doing a much better job of making sure our government is working for all people and not just some people, and that we see that in the data around safety and quality of life for communities that have been left behind.
Thanks. Daniel?
My North Star is the public health model and approach, and that is it's driven by data. It's highly focused on the individuals of greatest need and risk. But actually, more importantly, it's really about system change. When we, in public health, we think about populations and the conditions that create safety or health. And for me, that's the North Star, is we need to be focusing on, yes, the individuals of greatest need, like READI does so well, but we also have to look at the systems and the conditions that are generating the violence that we shouldn't stand for.
Well, thank you so much. I think my North Star would be that we get to a place where multi-billion-dollar police budgets are not a given, with not a lot of questions asked, but then violence interruption has to scratch and beg and gets nickeled and dimed in that same funding budget. I want to thank everybody. What an amazing panel we've had here this morning. I appreciate all your insights, and hopefully we offered something to all of you that you can take with you back to the communities that you're helping. So thank all of you for everything that you do. Thanks.
Now, please turn your attention to the screens for an address from United States Senator Dick Durbin.
Thank Heartland Alliance for inviting me to participate in the launch of this exciting new initiative to combat gun violence. READI Chicago has done incredible work on community violence intervention in some of the toughest neighborhoods in Chicago. Yours is a program that helps save lives. I'm confident that expanding its model on a national level can do the same to help other communities. The READI National Center for Safe Communities has the potential to be a game changer when it comes to community violence intervention. By establishing partnerships across the country and providing expert guidance and best practices on CVI models, the National Center will leverage resources so they can do the most good. The recent bipartisan gun safety legislation provided an unprecedented, really historic financial commitment to CVI programs, $250 million in federal grant funding. The National Center will help ensure this money is well spent. With gun violence now the leading cause of death for America's children, programs that focus on trauma-informed, evidence-based solutions are more critical than ever. Heartland Alliance understands the dramatic difference that a comprehensive all-hands-on-deck approach can make in breaking the cycle of violence. I'm glad that the READI National Center team will help lead that charge. Thanks for your tireless efforts. Let's keep working together to ensure our communities the safer, brighter future they deserve.
We will now take a short break for refreshments and resume the program at 11 a.m. Ladies and gentlemen, please take your seats. We'll resume the program momentarily. Ladies and gentlemen, please welcome to the stage Dr. Chico Tillman.
Man, I want to welcome everybody back. I see a few people still getting refreshments and everything. So, give everybody a chance to get back to their seat. We're about to transition at this part of the program and focus the conversation on capacity building and what the work looks like in CVI organizations on the ground. We laid the foundation talking about boots on the ground and direct service providers. Now we're going to have a conversation about capacity building, some of the challenges and what the work looks like. The goal at the National Center is to work arm in arm with community leaders, city officials, researchers, policymakers to find supports and help understand how to scale the great work that's being done in different communities, different cities, and different states. Next, you will hear from a panel of local officials and program directors about the needs they see in the field and what capacity building should look like in their communities. Please join me in welcoming our panelists and our moderator. Thank you.
Good morning, everybody. And good morning, and thank you, Chico, for that introduction. I am Evelyn Diaz. I am very proud to say that I am the president of Heartland Alliance. for human needs and human rights. And I am incredibly excited to be here this morning with all of you. Thank you for joining us, and importantly, thank you for all of the tireless work that you do to confront gun violence in your communities every single day. We are here today, as you've already heard, because gun violence has been taking an enormous toll on our communities across the country, particularly Black and brown communities, from LA to Chicago to Washington, D.C. Our young people are dying, and they're being excluded from opportunities to realize their dreams and their potential. For so many communities and for so many of us who've worked in this space for decades, threats to peace and safety in marginalized communities is not new. In fact, long before the pandemic sparked a conversation about inequities that exist across the country, we knew that they were there because we've been working to confront inequities in our communities every single day. What is new, though, what needs to be new, is our response to gun violence, because traditional law enforcement-based approaches have proven inadequate, and an over-reliance on aggressive policing and incarceration has exacerbated inequities and harm. We've already discussed today, but we are witnessing a shift in real time. Community-based approaches are now being seen as a necessary complement to constitutional policing, and that's because of all of you, outreach workers, philanthropic funders, clinicians, and elected officials. You have really just pioneered innovative community-based approaches to reducing gun violence that don't exacerbate the harms of the criminal justice system. Because of everyone in this room and the folks who work on the ground every day, there is so much promise in the CVI field, but there is so much need, and it's that combination of promise and need that is why we're here to launch the READI National Center for Safe Communities. So drawing on lessons from READI Chicago, the READI National Center will partner with cities and program implementers across the country to offer field support, technical assistance, and leadership development. Our goal is to share what we're learning about how to save lives, to work with other organizations who provide their own unique expertise, and empower communities across America to create public safety on their own terms. That's why I am so excited to launch this effort and to have this conversation today with our amazing panel about how we can expand the capacity of CVI programs nationwide. So I am joined today by a group of incredible leaders working to do exactly that. Amber Goodwin is an assistant district attorney at the Travis County District Attorney's Office, where she works on pretrial diversion and gun violence prevention policy. She's also the founder of the Community Justice Action Fund. Linda Harley Harper is Washington, D.C.'s first ever Director of Gun Violence Prevention in the Mayor's Office. Juanita Pai is Executive Director of Community Safety and Violence Prevention for the YMCA of Chicago. And Anthony Smith is Executive Director of Cities United. I'd like to start our conversation with a question for each of you, meaning I'm going to ask one question and ask each of you to answer it. And it's this. Let's just start with the why. Why is it important for us to be focused on long-term capacity building for CVI programs at this moment? And Amber, let's just start with you.
Thank you so much. Good morning. Is it still morning? Good morning, everyone. My name's Amber Goodwin, and I want to actually just first take a second of, I guess, personal privilege. And if you are a frontline worker or have ever worked in an office of violence prevention or work on the front lines, can you just stand up really quickly? Can we give everybody who is on the front lines of this work a round of applause? I think a lot of times, especially those of us who have worked in DC or worked in Congress in different places, we talk about the theoretical they and the people on the front lines, but there are people in this room right now on this panel who are doing the work to keep all of us safe every single day. So I don't want it to be mistaken that we are so grateful. I know I am personally grateful for all of the incredible work that you do. I think one of the reasons why it's important for the CVI capacity to be built is, and the other panel talked about it, but it's going to actually save lives. And I know the other panelists will talk specifically about, their work, and especially in offices of violence prevention, but the capacity that's being built right now for CVI is going to change the entire landscape of gun violence prevention in this country and across the world. Every single year, 40,000 people are killed by gun violence, and we talk so much about, because it's so important, and there's a disparate and disproportionate impact of gun violence in our communities and people who look like us. But the same can be said about, and Anthony has been doing incredible work on suicide prevention, which is many years is 2/3 of those 40,000 people who are dying every year. And when it comes to our communities, to Black and Brown, Latinx, Native, young people, the weapon of choice is firearms in so many of our communities. And we don't even have to talk ad nauseum, because we all know it, about what's happening with interpersonal violence and domestic violence. And so in our office, in the district attorney's office, and I know a lot of other organizations here are working on this too, it matters in the capacity that's being built, whether it's the evidence and the data, the efficacy. All the researchers who know me here know I am not great on buzzwords, but all the efficacies of these programs is, and I would say more importantly, innovation is important, because we're looking at that right now to make sure that we get it right whenever it comes to different programs that we can do, and how we can make sure that communities are actually leading all these other types of gun violence that we know are important and are happening in all of our cities across the country. And the last thing I would just say is, I think what the capacity could look like and what it should look like is exactly what Barbie was talking about, and the incredible work that they're doing in Harris County. And I know I'm from Texas, and so I know what they started with and just the incredible work that they've been able to do and the innovation. And so the capacity, number one, will save lives, but it also will have a ripple effect across the violence prevention movement to make sure that as we're thinking about how we change behavior, how we change, how we're looking at risk factors, and more importantly, how we're changing who is actually leading these different movements. It's not just a white person sitting in Washington, D.C., who is a policymaker. It's actually the people who are on the front lines. And so I think it's incredibly important as we're building this capacity that we are making sure to make a fine point about who's actually leading this movement on the ground as well.
Beautifully said. Linda, what do you think?
So thank you. I want to welcome to D.C. to everybody here who's not from here. And I want to just take 1 second to acknowledge that we're really grateful to the Heartland Alliance for having this event in D.C. and for opening it up to locals here. And so I want to acknowledge the members of my team from the Office of Gun Violence Prevention here in the district, as well as my colleagues in the Office of Neighborhood Safety and Engagement, Marcus Ellis and Satara Yell, who are here, and lots of other local guests, important guests that we have here. And we're grateful for the opportunity to have the door open, because a lot of times the District of Columbia gets forgotten about in the conversation, even though lots of people fly in and out and come here to seek funding and to talk about the work. Sometimes the district gets forgotten about. And we're not new to this. We've been doing the CVI work in excess of 4 years. We probably have close to 350 foot soldiers and administrators who are leading the CVI work here in the district. And so we are steadily growing, and we know that we have work to do, though. We know that we have work to do to go from good to great. And we are going to continue to work on that, and I think that part of that is the capacity building. We know that we have to make sure that we are creating systems that allow our communities to continue this work regardless of politics. No matter who's in the White House and no matter who's at City Hall, that in the District of Columbia we're able to continue this work beyond the politics. And we have the right people leading the work here. We have a powerful movement. But I think that very similar to what this gathering creates is the opportunity for us to share information and have peer-to-peer collaborative opportunities so that we can learn from each other, because it is interesting how we've been at this for 4 years, and there's some who are just now coming on board, and there's some who have been at it for several years as well. And we need to keep sharing information and keep realizing so that we don't have to learn tough lessons that another jurisdiction may have already learned, that we can learn from mistakes, and that we can all come together to figure out what we need to do to keep pushing this movement forward.
Thanks, Linda. Juanita.
Thank you, and good morning, everyone. I'm really happy to be in a space that celebrates those that are on the ground. And so I want to just thank everyone in this room for all the homage that you have paid to direct service providers. Why is it important to focus on the long-term capacity? I think that we can no longer ignore the loss of life, the impact that it has on our families, on our blocks, on our communities, and then on the greater society. We need to be committed to investing as much time and resources into repair as was invested in the disinvestment and the discrimination and oppression of communities of color. We're looking to change cultural norms, to change our responses to violence, and that will take time. Amber mentioned suicide prevention, and it was on my mind, the legal triad, right? In suicide prevention, they talk about alcohol, a firearm, and an individual being upset. Well, we have a few lethal triads in CVI. We have trauma and conflict, a firearm, and also alcohol. And so making sure that we are addressing all of those things in the work and committed for the long haul.
Great. Anthony.
Yeah, so also good morning. And I also want to just give a shout out to Dr. Chico and the READI team and the Heartland team for maximizing this moment and really coming together and really saying we can make a difference. I think, as Dr. Tillman talked about earlier, really it's about all of us working together, right? So I think that's the most important key. And when you look around the room and see the many folks from different aspects of the work in the room, all working to align together. And I think also when you think about the why, the folks that Amber had stand up is the why, right? That's the reason why we need to invest. And on the panel earlier today, we heard folks talk about, folks have been doing this work for years and decades without the resources. Just imagine if we had the right resources to really build out the capacity of each of the organizations that represent inside of the ecosystem to really move the work. We could save many more lives. But also, as you heard on the earlier panel, it's about saving lives and stopping incidents, but also creating pathways for folks to have better outcomes, right? So this ideal of investing in this moment and long term is because we're really not only trying to save lives, we're trying to make lives better for those who have been underserved for years and decades and really just change the course of the country. And I think the last point I'll make too is that, I'm gonna follow up on Walter's point, is that we never truly ask why it's important to invest in other parts of the public safety system. Why not? Why do we ask the question when it comes to this important work that we know matters and work? So it's like we really got to change the conversation. And at Cities United, we've been pushing for folks to really think about CVI and the community violence intervention work as part of the public safety sector, because people understand public safety, they understand what it is, but we're also trying to get folks to not only reimagine it, but redefine it, right? Everybody in this room is a part of the public safety sector, if there's that. And also, as Dr. Chico said, these are the heroes of the community, right? These are the folks who might not go home to their family. So why would they not get the same recognition as our police department and as our fire departments and our EMT folks, right? So this is why we got to invest in the long-term sustainability of this work, is to make sure that we're taking care of the workers, but also in turn that takes care of making sure that we keep more people alive and safe.
So back in the green room, before we came out, we said we were just going to roll with some, we're going to roll with the punches here. So I'm actually going to ask a question that you are all weren't prepared for in advance, but I think an important question for the audience, because we're talking about capacity building, and I want to give a sense of what we're talking about when we're talking about capacity building. So what does that word mean to you? When you think about building the capacity of a CVI implementing organization, a program, what kind of capacity needs to be built that you're seeing out there? Let's start with you, Linda.
Yeah, thank you for the question we didn't get to prepare for. But, I think that we should think of capacity building in terms of organization, infrastructure, but also people. I think that we know here in the district we have some of the best folks doing the work, but their capacity to manage this on a daily basis, we need to make sure that we are supporting them in that. We need to make sure that they're being traumatized and re-traumatized every day. And as in all of us, as we hear about the gun violence in our communities. And so I think to continue to build their toolboxes that they have as they go out into these communities and do the work that needs to be done, I think making sure that they have as many tools in their toolbox to ensure their own well-being, but also to be able to make sure that they're able to manage all of the stress that they are taking on and risk on a daily basis. But also the back office part of an organization is so important because we have so many folks who are entrepreneurs whose hearts are in the right place, who know this work, who know the communities inside and out, but we have to make sure that they have payroll systems that make sure that people get paid on time. We need to make sure that they have systems in place so that they're able to apply for grants and contracts and to write proposals, and that they understand what that looks like so that they are able to compete for all of the dollars that are now being put in this space right now. And we want to make sure that they're not left out. We want to make sure that the shiniest proposal doesn't win the awards that are being funded. We want to make sure that the right people are getting the funding and that we are equipping them with the tools they need to compete.
Thanks. Go ahead, Juanita.
Thank you. For me, capacity is some of the things that Linda shared around making sure that the structures are in place for both the research and the reporting that is required for the funding. Absolutely, the self-care of the individuals that are providing the services. But also, today we've heard that homicides increased 30 to 40%. Organizations have not had the ability to increase their staffing or their funding by 30 to 40%. So making sure that our response and the organizations have the ability to service all of the individuals that are being impacted.
I would say leadership development, but in a way that is not, hey, come and speak on this panel about being Black and what has happened to you in your past and trauma, but actually talking about how the leadership and all the different systems changes that everyone in this room is actually doing every single day, and giving the people that need and should have the platform and having other folks move out of the way so they have the ability to actually do the work. And I would also say, I know money, we always say money, and resources, but unrestricted resources, and those resources coming with the self-determination that I think all of us need, especially the people who are working on the front lines. And I'll just say very quickly, when I talk about self-determination, people are like, okay, what does that mean? And I always tell people, you know, a lot of us in here work with the students from Parkland and, you know, saw what happened there. And I had a reporter once ask me, like, what does it mean to be self-determination? I'm like, remember what it was like in 2018 when this Parkland shooting happened. And the students, so great, came out and had all of these different demands, and the entire globe listened. Half the people didn't know what an assault weapons ban was. They had no idea what these students and young people were talking about, but they were given the self-determination to decide what their demands were. They could walk into the halls of Congress, they could get a private jet from like an NFL, you know, owner, and they could decide what their destiny is. And we deserve the exact same thing without all the heartache that comes with it as well. And so I think making sure that when we have these resources, that it's not so restricted to where it does have to have the exact data point, it does have to have the exact shiny person who was in this exact article that the local newspaper put out, but that there is some innovation and self-determination that also goes along with the resources as well.
Great.
And all of what my sister said, and I would add for us, when we think about capacity building, it really is about the ecosystem, making sure that we have enough of each of the different components of it to really get the work done. Do we have enough outreach workers? Do we have enough interrupters? Do we have enough folks who can do the case management and the wraparound services? So when you're thinking about capacity, you're really looking at the whole system of CVI and making sure that each city has all of those pieces and parts working in partnership with each other and really supporting. And I would also say inside of that, capacity building for us at Cities United also supports the offices of violence prevention and community safety, like the ones that Marcus, Erica Atwood, Sasha, and Norm used to run, to really make sure that the work is being coordinated and moved internally, right? Because capacity building is also how do you organize internal government to provide better services to the community to support this work, right? So I think when you think about the wholeness of what the CVI ecosystem looks like and moves, you've got to make sure that each of those pieces have what it needs to really be effective and really address all of the concerns that we're talking about, right? So it all plays together. So really thinking about capacity is not just a program or one organization. How do we make sure all of these organizations are moving and have the capacity to move the way we need them to move to really address the issue? I think the last thing, too, when we think about capacity that was talked about on the earlier panel is that capacity also means we can shift and be nimble when violence shifts and when the movement of violence change, so that we're not stuck in the same ways, but we have enough opportunity to think about the work and to be thoughtful about the work. So for us, capacity means all of that. And we've got to really, really invest in all of that. So that goes back to your original question of this long term, is because it's not just one thing. It's multiple things moving together that all need resources to make this happen.
Thank you. I think that was really helpful. So Amber, I'm going to come back to you here. You founded the Community Justice Action Fund, which successfully advocated for significant funding for CVI organizations at the federal level. You also served as a member of the Biden transition team that was working to organize gun violence prevention groups. So my question is this: as we continue to build the CVI field and look ahead, what is the federal government's role in building the capacity of local CVI organizations?
That's a great question. I'm glad that I knew it beforehand, this one. I first want to just, again, shout out the folks who have been doing this work for a really long time, and Greg Jackson, who can't see, the lights are blinding me, but Greg Jackson, who had an incredible amount of all the work. When we talk about the amount of money that is coming from the federal government, we're not talking about millions of dollars. We're not talking about $1 billion. We're talking about tens of billions of dollars, and Greg just did an incredible job. I know when I was on the transition and doing different things, so I want to shout out Greg, but also one of the things that I think was so incredible about what the federal government has done, and many people have been working to try and get the federal government to do work on CVI for decades, way before I was doing this work, was that we decided that we wanted to fight for a whole of government approach, and as you'll hear probably from Ambassador Rice, that's what they did. Is that they took a whole of government approach at the federal level, that now what we can do, hopefully, in the local level is, I work for a district, I'm an assistant district attorney, and so traditionally a lot of people don't think that an assistant district attorney would be working on gun violence, but I've gotten to working with Norman, I've gotten to work with Anthony and so many different people. So I think the federal government's role is to take a whole of government approach. So we're not just saying, which we have done and had to do for so many years, was to say, okay, we can only go to DOJ, and shout out to Eddie Bocanegra, who's an incredible, one of my heroes as well, but that we could only go to DOJ if we wanted money for our work. It had to be through the criminal justice system. We were taking this approach, and that is it. And now we can, because of all the work of all of you in this room, we can say we're going to talk to the CDC, and the CDC is going to have an approach to this, and we're also going to talk to HHS. We're actually going to talk to the Department of Education, because this is a problem that's happening in our schools, and we're going to take an approach that goes all the way up and down all these different systems. So I think the federal government's role is obviously to get out the dollars in a way that is reflective of what the needs are on the ground, but also to hopefully help build systems across the government that we can also work for and look to as models that we can use on the local government as well.
Thank you for that. Linda, I am going to turn to you. You're a DC native and the first director of gun violence prevention here in Washington. You play a really critical role in how the city works with local organizations, community members, law enforcement to make the district safer. So what can local governments do to support the growth and long-term sustainability of the CVI sector?
No, it's a great question, and it's not an easy answer. I think that here in the district, we have grown exponentially over the past few years in the CVI space, which is amazing. But we also have to navigate collaboration and coordination and identifying roles. And so for other jurisdictions, that would be sort of a lesson learned that I would love to have conversation with other jurisdictions that are starting up about some of the landmines that we experience in learning how to coordinate and having a whole of government approach. Whole of government approach is a great concept, but actually on a day-to-day basis, working together, you know, many of us know what it's like just to go to the DMV to try to get your license and all of the barriers and hurdles that you might experience and some of the challenges. And I think just making that a smoother process and learning how government agencies can work together sometimes is even more challenging than community-based organizations. But I also think that continuing to have opportunities like this one, where we're able to talk to each other as peers and to learn from each other, is really the key for our long-term sustainability, so that we can learn from each other.
Thank you for that, Linda. Juanita, as the Executive Director of Community Safety and Violence Prevention for the YMCA of Chicago, let's get some of your on-the-ground perspective here. As someone who's worked extensively to support community ties that prevent violence, what are some of the capacity challenges that CVI organizations face, and how would investments in capacity strengthening help those organizations reach more people or establish more sustainable programs?
Thank you. On the ground, we're seeing a few things and how those challenges show up. And so the first thing I would share around is an increase in a diversity in funding around prevention. And so I'll give you an example. This past week, we had 10 to 13 shootings in our South Shore neighborhood. A few were homicides, but in a span of 4 to 6 minutes, there was a retaliatory shooter. And so being able to work with individuals prior to an incident is critical. In working with them, we need to have the ability to fund in an emergency, not after an application for VOCA funds, food, housing, and transportation. Another challenge that we're seeing in Cook County is around the rate of incarceration for individuals, but specifically those in possession of a firearm. So currently there's about 25% of Cook County cases that are firearm possession. There isn't a distinction between an individual that is committing a crime versus an individual that has decided to carry a firearm in fear. I have an 18-year-old that is currently in the Department of Corrections, arrested for carrying a firearm under 90 days after his 18th birthday, and was congratulated for becoming a felon. And so this individual, what the state's attorney's office and the courts didn't know was that this individual, when he should have been starting his junior year of high school, was burying a childhood friend, 16-year-old female, Akira, was shot. 2 years prior, his sister was shot. Her boyfriend was murdered, and his sister is paralyzed. He weighed into the Department of Corrections at 95 pounds, 5'9". And so this individual has never committed a violent crime, but now, upon his release, we will be dealing with the barriers in which come with becoming a convicted felon. The inability to attend school, the inability to attain housing and employment. And so those challenges are working counterproductive to our work. Some additional challenges that we see are around the funding and its identification of who a high-risk individual is. And so leaving that to the credible messages in the community to determine what the risk level is for an individual, I think, is extremely important. And I had a third point, but I lost it.
That's a good point to end on, actually. And one of the things that we did find in the READI Chicago study, where we had 3 different pathways to enter into the program, and that community pathway was the strongest one. And it was just trusting, and that came from our community partners initially in the design, where they said, listen, we get, like, data can tell us so much, but we're on the ground. We see minute by minute who's at the highest risk, and it can change from day to day. And so, just trusting in that local intelligence and the local groups was one way we decided to go, and it turned out to be a really high impact for getting the right guys and having the best outcomes for those guys. So, Anthony, you head up Cities United. That is an initiative helping over 130 mayors across the country decrease violence and promote justice through increasing opportunity for Black men and boys. What are some of the lessons that you've learned from working with cities across the country that we can learn from?
Yeah, thank you again for that. And Lots of lessons are learned every day, right? And I think part of it is I just also want to say, I started this work in Louisville, opening up the office for Mayor Fisher in 2013. And I learned a lot of lessons just there. And it's still open and running, and watching how it's progressed since my transition out as a big lesson. Is because, again, it goes back to the investment. And it goes back to when I started at office, it was one person with a very small budget, maybe of about $500,000, if that. And now it's an office of maybe about 15 or 20 people with a budget of about $5 million, right? So I think what we know is that you need to invest early and often and not wait, right? So I think part of this is really thinking about, I think we've learned a lot around what the true cost is to really move an ecosystem and move the work. So being able to help mayors understand that, you know, it's going to cost you on average $20,000 to $30,000 per participant to really get a budget, and then helping them break down their numbers and really walking through a process. So I can go in clearly with cities now and they say, this is the number, a starting number that you need to think about how to invest in the work, right? So I think over the years, we've been able to really get down to a place where we can say, this is what it costs. I can also go into a space now and really start assessing what their ecosystem looks like and what's the gaps and what's missing from that. That's do a lot of work with folks in this room from the civic project that we're doing in partnership with the White House, with other national organizations, and just a lot of different people have really influenced this work around what does it take to get this done. So now being clear about what does it take, I can also say to mayors and cities, you got to look at your data long term, right? You need to go at least 5 to 10 years back and look at your trends and not just worry about year to year. Because I think that's where folks get caught up at, right? Because, you know, we've seen a spike over the last 2 years. I was just in Seattle, and the folks from King County are here, so good to see you all. And they're looking at their numbers as for the longest has been 18 to 24-year-olds. This year, they're looking at 18 to 35-year-olds and trying to figure out what's the shift in the trend, right? So really saying to mayors, you got to pay attention to your data, long term, but also look at the spike so you can really deploy folks the right way. So just a lot of different lessons learned there. Then also the political will, right? So although we work in partnership with mayors, there's still relationships to build with council members, with your state representatives, and with your federal representatives to make sure that everybody understands what the needs and what their role is. And I think the last thing I'll say too is that the big lesson learned for us is that you've got to engage local philanthropy early in this conversation. I think there's a lot of national partners who have invested in this work and are continuing to, but it's also got to have your local foundations at the table. And they've got to understand, again, this got to be long-term investment. So when you're going to the table and you're asking folks to invest in the work, you're giving them a plan for 3 to 5 years. This is not just about what we're going to do this year. I need to let you know, for me to really make an impact, I need this amount of money and I need this amount of resources over the next 3 to 5 years. And one of the things I've also said to local funders is not only that I need your money, I need your voice, I need your advocacy. Because people move differently when you are in the room having those conversations. They expect it from me. They don't expect it from the white-led foundations to be a partner and go to council members and go to their different places to say this work matters, right? So building that network of advocacy and that network of folks who can advocate on your behalf is also very important in the lesson learned.
So you're reminding me that we're talking about capacity building of CVI programs, but we can't do that. This is what it sounds like. We can't do that without recognizing that those organizations won't succeed without partnerships, critical partnerships with government and with philanthropic funders. And so are there models that you've seen across the country where that partnership is something, you know, other cities can learn from? It's kind of best practice cities.
Best practice cities. I think there's some emerging best practices, let me say it that way, right? I think what they're doing in King County with their regional approach is a promising best practice that I think is going to show some results. I think what Erica and the Philly team are doing with Erica's over here, I thought she was over here, what they're doing with their network and trying to really bring a lot of people together to the table, I think is going to be important. Also what they're doing in D.C., right? I think what's happening here in D.C. is something that folks should be paying attention to. One of the things that we did not highlight is I've been watching the Peace Academy And I think it's a thing that every city should have, where you actually are training your frontline worker in cohorts around 18 weeks, I think is what the program was. And they not only get the training, they get to do it in partnership with other folks within, so you're building relationships. I also think what they're doing in Baltimore, I think what Mayor Scott and Director Jackson are doing really around internally organizing, but also externally funding the work on the ground. So I think it's coming. And I think, as Cities United, that's what we push as hand. You need to have a comprehensive approach to public safety, which means you got to build a comprehensive team of all of these different stakeholders who need to be at the table to really move an agenda. And while I got the mic, I'm going to do a quick plug. If you're in Baltimore, October the 26th through the 28th, we're hosting our annual convening. It's the 9th annual convening. We'd love to have everybody here. You can go to citiesunited.org and log in, and you'll see how to register for that. It's free, but you got to pay for your way to get there. So just want to say that we want folks to join us. So,
can I just add something really quick to what Anthony said, which is, I think for so long, and obviously so many different stakeholders have had a role to play in this, but we focus, not we, but the proverbial we have focused on mayors and members of Congress. And there's thousands, if not hundreds of thousands, of policymakers, either elected or appointed, that are in between those two, that have potentially larger purse strings than the mayors or even the members of Congress, or have the ability to be held accountable by their constituents. And so what's been so great about organizations like Cities United and others that are here, and what's really incredible about what Dr. Tillman and READI is doing, is that those different levels of government are not only going to get the resources and get the framework, but they're also going to be able to be connected to other people across the entire country, because it is hard, I can say, as people who have kind of been left out of the conversation on gun violence a lot as elected officials and even as prosecutors, that everyone has a role to play, right? And so I think as advocates and as people who care about this issue, that it's also incumbent on us to make sure that we are engaging and holding accountable other forms of elected official that maybe aren't as easily seen in the gun violence prevention movement as members of Congress and our mayors too.
Yeah. Well, I'm sorry, just one more thing. And just to, because I failed to mention what Amber and them are doing in Travis County. A lot of us was there for their first kind of summit, and they had all of the different folks. And one of the things that happened in that space is I was sitting with the school board folks and then the superintendent, and when they left the meeting, they were going to a budget meeting, and based on that meeting, they were shifting money to make sure that they had resources to bring in CBI workers into the school system, right? So bringing folks into a room and educating them is important. And to Amber's point, you got to have that different forms of leadership. And the prosecutor there was the Gonzalez, Garza, brought all of these folks to the table and really helped push that agenda, right? So it's, again, what we've learned is mayors are important, but they're not the only ones who are important to the conversation. So
it's a great point. I'm gonna do two more questions and then ask each of you to answer those two questions. I'm gonna start with this one. READI National Center for Safe Communities is launching today here, and we have talked about it as offering field support to cities, technical assistance, leadership development training. But I would love for the audience to hear from you what your highest vision is for what READI National Center can do, what it can bring, what you hope to see come out of the READI National Center. And we'll start with you, Linda, and we'll work our way across.
Sure. So I think I'm thrilled about this, but I think that it's just the beginning. I think that what I would love to see is for us to continue to elevate this conversation loudly, because there are a lot of persons who don't understand what CVI work is, who don't know. And so being part of a national campaign to really push and to educate persons who are not always, who don't live in communities that are impacted by gun violence, who it's foreign to them, but yet they have lots of networks that can help us to bring resources to this space, I think is so important, because under President Biden, now we are talking about CVI nationally, but I still think, and we see it here locally, everybody doesn't understand the work. They don't know what it really is. They hear about violence interruption. They hear about credible messengers. They know that all they hear about is gun violence and tragic stories continuing. And so, but yet we know that the folks who are doing this work, we have no shortage of success stories. You can talk to anyone who was doing the work here in the district, and they all can point to transformation stories where persons have bought in, who have connected, who have made a decision to transform their lives. I think that we just have to continue to lift that up so that those who are not always connected to this work would have a better understanding of what it is and recognize why it's good for the entire city, in our case, and good for the entire city, even if it is focused on specific communities, and why that's important.
Thank you. I'm extremely excited. We all in this room know that one of the leading root causes of violence is mistrust in police. And so understanding that the police department will be brought in, it's my hope that the results of this academy is neighborhoods in Chicago are policed the same. And so despite if you're on the north side or if you're in Inglewood or Roseland on the south side, your encounters with police are the same. They're with dignity, respect. They're not accusatory. My hope is that the community organizations and the leadership they build relationships. I know through everything that I do that relationships heal. And so being able to bridge those divides and create those relationships, create an understanding, my hope is that we don't have to continue to do this work.
Great, thank you. My hope is that just through the different, I think talking points that we've talked about with the READI launch is that there's a framework that's provided. So as you just said, people don't have to continue to do this work, but just raise your hand, anyone here, if whenever you started in an Office of Violence Prevention, for anyone who's worked or started in Office of Violence Prevention, if when you started you were like, I know every single thing I'm supposed to do, I do not need anyone's help, and I've got it, funders over there, I got the money, everything, so anyone's hands up? Okay, I can't see, but there may be someone's hands that are up. I'm kind of joking about this, but building the capacity and making sure that there's an actual framework. I'm sure Dr. Tillman is probably like, now Amber will stop bothering me all the time. She can actually go through the proper channels of everyone who's going to be working on this national initiative, but it's going to create systems, and I think that's what's so important, because I think a lot of us sometimes think of systems as a bad thing, but systems are really important, so we don't have to recreate the wheel, we don't have to go through a lot of the burdens, and we can talk about how beautiful this work is and how it is saving lives and how so many people in this room are keeping all of us safe every single day versus just talking about the burdens. And so I think that just having the framework and having like an actual home for people to be able to do this is going to just be incredible for the entire field. Great.
Yeah, I think my hope is that we continue to create more pathways for those most impacted by gun violence, right? I think what READI does and has done is it engages the members of community who are most impacted and really help them get on a pathway and help them find what's next. And I just want to see that across the country, right? I think the CVI world is growing, and I think READI is stepping in at the right time when we've got enough resources to actually do the outreach, to do the intervention, and do the case management. But then what's next? And I think this what's next is what READI is bringing to the table, is saying, okay, now we got you. You're ready. Now let's help you move forward, and let us help you create that pathway to your better outcome, right? And I think so. That's the hope for me. But I also just want to echo Amber's point: is that now that communities can add this to their framework and to their tool belt of how they move the work, because for far too long, I think this piece has been left out of the conversation.
Mm-hmm. That's great. I'll add this. I feel like one of the READI is one program model of many that we've seen across the country. We were fortunate enough to be able to evaluate it, and so that has some value. But I think the real promise for the READI National Center is now we're thinking about the value of letting 1,000 flowers bloom, or a million, whatever that expression is. Let all the flowers bloom, but doing it in a way where it's not like the wild, wild west, where everybody's just kind of doing their own thing with their own, limited resources. But we're saying if we actually come together and talk about what it takes to deliver a high quality program and then continue to learn, now we have a national infrastructure of CVI that I don't know. It's just I'm inspired by the notion of having like that kind of coverage, those kinds of stories, that kind of impact across the United States. So, so thanks for answering that. My last question to you is, we have an audience here, a large audience of folks, and let's just wrap up by having each of you tell us what's the most important thing that they can do to support the work and increase the capacity of CVI organizations. And Anthony, I'll just start with you, and Linda, I'll give you the last word. We'll just go around.
Yeah, so I think the most important thing folks in this room can do to support the capacity building of CVI is, one, take care of yourselves, right? We heard it earlier today, right? We are all in this because we care deeply about the folks who are impacted by this work in the communities that they live in. But you can't be on 24 hours a day, right? So you've got to figure out how to take care of yourself. It's okay to take a vacation. It's okay to leave your phone home. It's okay not to pick up that call because I just think folks got to take time, right? So, and I'm speaking to myself more so than I'm speaking to any of you all. So just be clear about that. We've got to take time, right? We've got to take time. And I think also we've got to build, I heard it earlier today, the relationships that are going to help us move the work forward, right? So we are going to have to be at tables at times with people we just don't have don't like, let me just say it that way, or we have difference of opinions about things, but everybody needs to be a part of this conversation. I was talking to my team one day, and it's like, we lost 4 years at the federal level because some of us didn't want to engage. And some of us, mean me, did not want to engage. But we can't lose 4 more years, right? So if we've got to be able to and willing to sit at tables and advocate for this because it matters. So I think that's the thing. But then also, advocate at the local level, right? Making sure that, it was also said earlier, that CVI organizations at your local level have the resources they need to pay people a livable wage, right? Where they can take care of themselves and their families, that they have health benefits, that they get to take time off, that they have access to mental health services and providers themselves. So the advocacy work that we need really is around for ourselves. We've got to make sure that we're advocating at all levels of government, but then also making sure that the folks who are doing the frontline work every day have what they need. And they need us to be the advocates for that when we're in certain rooms.
Great.
Yeah, I mean, do I go next? I think that what's needed in capacity is the ability for people on the front lines and the people who are integral to this work, and sometimes that's policymakers, sometimes that's funders, to have the freedom to just do the work. So can all of us imagine in the day-to-day work that we're signed up to do, maybe some of us have job descriptions, maybe some of us don't, but if you could just do what was on your to-do list and didn't have to worry about some of the infractions and different things that we have to deal with, especially as Black people doing this work, it would provide the freedom to actually be able to just do the work. And I think that that sounds very simple, but I think for all of us up here, that if we didn't have to worry about, is this the exact right way that I should be writing this to make sure that we get this funding, or did I say this correctly? And I think that's something that's very important for the capacity as we think about what we're building up for people, so we're not adding on more to that, more to people, especially the folks on the front lines. And the last thing I'll say is this quote that I was on TikTok the other day, and my little sister's like, Amber, you're too old to be on TikTok, but I'm not. And so I was on TikTok the other day, and Erica Alexander, who was Cousin Pam, but she was also an incredible actor and just activist, was talking about Black people and sci-fi and just different stuff. And she was talking about how her husband and her are always talking to people about how Black people, and especially people of color, Black people in particular, we don't see ourselves in the future. We don't see ourselves. That's why we don't like sci-fi, which we all know is not correct. Like, we like all types of movies. But she said this quote, which was, for Black people in this country, in America, the past is painful, the present is precarious, but the future is free. So if we think about like the work that needs to be done and the freedom that we're all seeking, especially like what is happening with, this launch and the freedom that we all need to be able to do this work, thinking about this is a way for us to think about how we can actually do this work that will free our communities from violence, that will make it to where we can walk down the streets, to make it to where we don't have to feel the burden of violence every single day. And we can just make our lives, as Anthony always says to us, healthy and hopeful communities instead of ones that are fighting against violence every single day.
Beautifully said.
Thank you. I think, and I remember my third point, and it was public trust. And so what I would ask this group is to share our narrative, share the stories around how working together works, and then also work together. There isn't an individual that I've encountered that couldn't use support in other areas, whether that was mental health or housing. And so doing this work, understanding the partnerships that you should have, the stakeholders that should be at the table, and then advocating for longer grant cycles. 3 years, 5 years for a grant cycle is not enough time. If we're going to commit to this, we need to make commitments beyond a person's time in office, and that represent, we saw with early education, right? Like there was decades of research that went into the benefits of Head Start, and now there's funding and supports for Head Start. In Illinois, it's like Head Start for All and different things like that. That's the story that we should be telling about our CVI work. Working with the systems, as Amber shared, and not only working with the end user. When I think about firearm violence in where I come from, there's this saying that I would rather be judged by 12 than carried by 6. And so until we address the fear that we have in our communities, arresting folks for firearms and not addressing their demand, right, doesn't support the end goal. So always work together with everyone, to Anthony's point, even those that you might not like. And
Yes.
thank you.
I think what I would say is, your question is, what can everyone in this room do? I think it's to speak love into the CVI work. I think that, you know, this is work that comes from the heart. Someone said that earlier on the panel. It's very personal to those who do the work. We have to make sure that we are acknowledging that those who are doing the CVI work are the experts, and that we have to lift them up when we talk about it among people who may not be as familiar with the work as we are. That we know that we are using our voices and the power of our voices to lift up the work in a way to help people to understand that those who are doing the work come from the communities. They know what the communities need, and many of them who are returning citizens are coming home, and they want to give back, which is a really healing process for everybody. And we have to acknowledge the value that that brings. And for me, I'm always inspired here in the district with the love that is, there's a powerful love force between those who are in the returning citizens community here in the district. They lift each other up, and they look out for each other, and they talk about each other in a really positive and loving way. And I think that we need to make sure that whenever we are speaking about the work, that we're acknowledging that the CVI workers are the experts, and that we are in partnership with communities. And that we don't have the answers as the government, that we have to partner with communities in order to create safe and healthy communities and to provide the resources there to make it possible.
Well, thank you for bringing the word love into this panel, because I do think that when you visit, when you're in it, when you're in one of the programs, experiencing it, that is an overwhelming emotion, right? As you feel the love and you recognize how important that is in the healing process and the trust building process. And it's a word that doesn't get enough usage, I think, when we in policy spaces. But first of all, I want to thank all of you for sharing your thoughts, for your leadership in this space over so many years. You have so much to offer the field as we go forward, and I appreciate what you've offered to us today. So let me ask the audience to join me in thanking our panelists for today. And I would be a terrible boss if I didn't take the opportunity to tell you how proud I am of the READI Chicago team, of Dr. Chico Tillman, who has taken the mantle from Eddie Bocanegra, who's now at DOJ, but who nurtured READI Chicago for 5 years. Jorge Matos, who has taken the reins of READI Chicago. And of course, Dr. Chico Tillman, who is making the National Center come to life. What I love about these men is that they have just an enormous heart and love for the men that we're working with in communities, for the community-based partners that we work with, but they also see so much more as possible for the field, and so they're also taking a stand for we can be stronger, we can go further, and then they're acting on it. And so I'm just incredibly proud to call them members of my team and to work with them. So thank you to Heartland Alliance, READI Chicago team. Please join me in thanking them. And at this time, I think Dr. Chico Tillman is going to come out, or is that right? Is he there? Okay, we're taking a short break, and we'll let you know when to come back. Thank you.
Ladies and gentlemen, please retake your seats. The program will resume momentarily.
Everybody, please do me a favor and return to your seats, if you will. We at the crescendo or the apex and closing of the program. If you think about the work, and particularly in violence prevention, over the last 20 years, it's been somewhat of a challenge or a struggle to get funding or to get support at different levels to move the work. In many cases, we were working with scraps. But over the last few years, and particularly since this administration came in, we've seen an influx of funding that we've never before experienced. I'm truly humbled, honored, and have a bit of gratitude to introduce our final speaker of the day. When President Biden first took office, if you think about it, no administration had invested more than $25 million in violence prevention, and the $25 million was in research. We were able to move the needle, not just because of our advocacy and our efforts, but because of this person I'm about to bring to the stage, none other than Ambassador Susan Rice. She has changed that. From the start, she worked hand in hand with Black and Brown organizations throughout the United States, in particular the Black and Brown Peace Consortium. She invited us to the White House, to the Oval Office. She listened to our concerns about violence prevention. She discussed some of the challenges we were actually going through in our communities throughout the country. More than anything, she didn't just invite us, she listened. And one of the challenges in our community is we're used to rejection, we have become used to disappointment, so we have reservation. But she gave us her word, and I can honestly say that she has kept her word throughout this whole movement. Susan Rice is a champion for the work. She's a leader for the work, an advocate for the work. More importantly, she's someone who cares about the work. I ask you, with my deepest plea, please stand and honor a person who made it possible for us to be resourced to do the important work we do, and give her a warm CVI round of applause as we welcome our champion in the work, Ambassador Susan Rice.
Thank you so much. That's incredibly kind. Thank you, Chico. Thank you for your friendship and partnership. And thank you to all of you for the extraordinary work you do. It's really great to be with you. You are such dedicated CVI leaders who've sacrificed so much to save so many lives. and you're valued partners of the Biden-Harris administration. From the start of his administration, President Biden has been deeply committed to reducing gun violence, not only mass shootings, but the daily gun violence that doesn't often make the headlines. As he says, the equivalent of mass shootings happen every day in too many neighborhoods. Young lives stolen or forever altered by a bullet. Parks and street corners turned into war zones. Communities, disproportionately black and brown communities, ripped apart. We simply cannot continue like this. And as groups like READI are demonstrating, we don't have to. In March, I had the opportunity to visit Chico and READI Chicago on the West Side and witness READI's work firsthand. I met program participants receiving cognitive behavioral therapy, the gold standard for treating trauma and other conditions. They told of how READI saved their lives by giving them hope, by giving them people who cared and skills that they need. Like the CVI programs I visited in New York and DC, it was a remarkable demonstration of how an entire community can mobilize to try to break the cycle of violence, connecting people who could be caught up in violence to employment, providing housing and supportive services, helping reunite formerly incarcerated individuals with their families. As you all know well, this work is incredibly effective. Community violence intervention has been shown to reduce violence in some studies by as much as 60%. One study looked at READI participants who'd been arrested at least 17 times on average, and more than a third of whom had been shot at least once. After READI's interventions, these men were 80% less likely to be arrested for a shooting or a homicide. CVI is saving lives and transforming communities. It's also easing the burden on law enforcement so they can better focus their resources. The success of CVI is why it's so encouraging that this new READI National Center will be offering training and guidance for other communities that want to implement or scale their own community violence intervention efforts. And that's also why I'm proud that President Biden has made CVI a cornerstone of our administration's gun violence prevention strategy. And that strategy has 3 pillars. First, we're taking common sense steps to keep dangerous weapons off our streets and out of the wrong hands. During President Biden's first 19 months as president, his administration has taken more executive action to curb gun violence than any president at this point in their presidency. We're cracking down on ghost guns and gun trafficking. We've established zero-tolerance policy for rogue gun dealers. We've put out model red flag legislation for states and are promoting suicide prevention and safe firearm storage. In July, the Senate confirmed Steve Dettelbach as the first permanent head of the Bureau of Alcohol, Tobacco, Firearms, and Explosives in more than 7 years. And he is playing a leading role in helping to take guns off our streets. On top of that, after decades of gridlock and in the face of fierce NRA lobbying, Congress passed the Bipartisan Safer Communities Act, the first significant gun violence reduction legislation in 30 years. Second, we're urging cities and states to invest in accountable community policing, from Albuquerque to Milwaukee, because we know effective, accountable policing is vital to keeping our communities safe. Third, we're investing in crime prevention and a fairer criminal justice system. Cities and states are using American Rescue Plan funds to hire school counselors and social workers, to expand job training and other programs so that our young people can pick up a trade rather than a gun. And central to our administration's crime prevention efforts is an unprecedented and innovative focus on community violence intervention. In June of 2021, we established a new CVI collaborative bringing together 16 jurisdictions from Baton Rouge to Baltimore to build trust, to engage communities, and share creative strategies that can be scaled nationwide. We've made changes to more than 24 existing federal programs to prioritize CVI and get federal funds out into communities. The Department of Housing and Urban Development, for instance, has encouraged communities to use community development block grants to support CVI, while the Centers for Disease Control and Prevention is funding research on how to prevent burnout among CVI workers. As part of his call for cities and states to leverage some of the $350 billion in American Rescue Plan state and local funding to make their communities safer, President Biden has urged cities and states to invest in community violence intervention. And collectively, communities have committed hundreds of millions of dollars to CVI strategies. Here in Washington, D.C., the city is creating a training academy and certification system to help professionalize violence interrupters. And it has deployed 50 new violence interrupters in 24 neighborhoods. Los Angeles, for instance, has invested over $89 million towards public safety and violence prevention, including expanding systems of care, creating jobs, and addressing trauma. I encourage everyone to push your own communities. If you're already investing in violence intervention, see if you can do even more. If you haven't done it yet, do it now. Let's use these dollars to save lives. We also need Congress to do more. President Biden fought for and won $50 million in new federal funding exclusively for community violence interventions. The Bipartisan Safer Communities Act devotes another $250 million to CVI over 5 years. That's $300 million for the first ever federal funding stream solely dedicated to CVI. No longer will you have to compete with other priorities to have a chance at federal funding. But we know it's not enough. In the coming years, we must double down on our progress. The President's 2023 budget request and his Safer America plan call on Congress to fund $5 billion over 10 years for CVI in discretionary and mandatory resources, with $500 million for violence intervention in fiscal 2023, split equally between the Department of Justice and the Department of Health and Human Services, because gun violence is about public safety and public health. The reality is, when more than 320 Americans are shot each day and over 100 of them killed, none of us can afford to rest. We have to continue to push for more resources for violence prevention and intervention. We must continue pressing Congress to ban assault weapons and expand background checks. We must continue doing everything in our power to advance the life-saving and heroic work of preventing the bloodshed that stains our communities and our conscience. Today, on the streets of St. Louis, a violence interrupter is putting herself in the middle of a dispute to put her community on a better path. In a hospital in Memphis, there's a CVI worker helping a shooting victim seek out employment rather than retaliation. There's a classroom in Chicago where a cognitive behavioral therapist is helping a young man work through trauma. Some of these dedicated workers will succeed. Some of them won't. Some of them tragically will lose their lives trying to save others. These unsung heroes deserve our profound gratitude and respect, that of all of us, all Americans. And they deserve the good pay, benefits, and support they need. They demand our sustained investment. They require our urgent and unceasing action. By harnessing the passion and the purpose in this room, I know we can help diffuse violence before it rips through our communities year after year after year. And we can make all of our streets safer and more vibrant for all. Thank you all for what you do. Thank you for your partnership. God bless you.
Now let's give her a real applause. Come on, you can do better than that. Come on. She said they trying to give us $5 billion. That's enough to give a real applause about. When I said I was humbled and I'm thankful for somebody like that, I'm inspired when somebody finally gets it. You know, somebody really understands the pain that's going on in vulnerable communities throughout the United States. But what I'm really excited about is you, each and every one of you. I can't even describe how I'm feeling inside for having the audacity to reach out to all the people I've worked with, I've known through over decades in this work, and you coming out with me to DC to celebrate us taking the work to the next level. I appreciate you, I love you, but now I gotta charge you, it's time to get to work. I know you've been working hard, but now we gotta go to the next level. Just like in sports, it's the playoff time now. The regular season over, we got to go to the next level. We really do. The microscope is on us. People are watching us. They've heard our voice. Now they have to see the hard work we've been doing throughout the decade. Let's document it. Let's show the data. Let's show it works. And then we want to hold them accountable to make CVI a permanent part of the public safety ecosystem, where we're not scrambling for grants, and we're an item line on each level of government. Everyone is using the word equitable, equitable, equitable. Now it's time that we be treated equitable. Thank you. Let's get to work. Before we leave, I want to acknowledge, could everybody from Heartland Alliance please stand up that made this possible, please? Shout out to everybody. And I'm gonna say one last thing. I really appreciate our leader, Evelyn Diaz, for giving me the opportunity and having the audacity to say, you know what, we gonna step out and make a difference. And I'm going to give you an opportunity to lead this charge. So I thank you, I thank you, I thank you. Let's do it. I believe in y'all, and I know we can do it. You know why? Because we've been doing it all along. Y'all have a wonderful day, and God bless.